The trauma bay at Harlan Ridge Military Medical Center shook when 5 gurneys crashed through the doors simultaneously. 5 Navy SEALs, unconscious, bleeding, bodies shutting down in synchronized patterns nobody could explain. Chief Surgeon Dr. Garrett Wynn scanned the chaos, spotted the newest face on the floor, and pointed, "Give them to the rookie." The room laughed. Nurse Mara Solis didn't. She stepped forward, pulled on her gloves, and started her timer. What she saw in the next 30 seconds wasn't in any textbook at Harlan Ridge. It was something she'd learned in places this hospital couldn't imagine. Before this story goes any further, if you've never been here before, hit that subscribe button right now, because the stories on this channel do not slow down and they do not go easy. Every week we bring you cinematic fiction that will keep you awake, keep you thinking, and keep you coming back. Hit the like button if you're already feeling it, and drop a comment telling me what city and country you're watching from. I want to see exactly how far this story travels. Now, let's go back inside that trauma bay, because Mara Solis is about to do something nobody in that room will forget for the rest of their careers. The call had come in at 11:47 p.m. Not one trauma. 5. The dispatcher's voice on the overhead had been steady, clipped, the kind of calm that only meant the person speaking had already made peace with what they were sending into the building. Inbound, 5 adult males, military personnel, training incident, ETA 4 minutes. 4 minutes. Harlan Ridge Military Medical Center sat on the edge of Caldwell County in the flat, wind-scraped landscape of western Montana, and on most nights the trauma bay saw 2, maybe 3 patients moving through at a time. Tonight, the charge nurse had already started pulling extra supply carts before the second radio crackle even finished. Everyone felt it, that specific shift in air pressure that happened when something bad was coming, and there was no negotiating it down. Mara Solis was charting at the corner station when the call came through. She was 29, not visibly remarkable, with dark hair pulled back in a low bun that never seemed to move regardless of what was happening around her. She had been at Harlan Ridge for 11 weeks. 11 weeks of being handed the stable patients, the routine post-ops, the quiet halls. 11 weeks of the other nurses explaining things to her slowly, as if she might not understand. 11 weeks of Dr. Garrett Wynn walking past her without making eye contact. She closed her chart, capped her pen, and stood. The ambulance bay doors blew open at 11:51. They came in fast, all 5 gurneys moving at near simultaneous speed, paramedics calling out vitals in overlapping voices that crashed into each other like weather systems colliding. The overhead fluorescence threw hard white light across 5 faces, 5 sets of hands, 5 bodies that were large and trained and built for punishment and were somehow all failing at once. Mara moved to the edge of the bay and watched, not standing still, watching. Her eyes moved between the patients with the systematic rhythm of someone running a mental checklist that had nothing to do with hospital protocol. She tracked breathing rates, eye position, the way each man's chest rose and fell, or didn't, the color of fingernails, the particular stillness of one man's left hand versus the restless tremoring of another's. Dr. Wynn was already at the center of the room, tall and sharp-jawed, wearing the particular brand of authority that came from 15 years of people stepping aside when he walked through a door. He had 2 residents flanking him, Dr. Tobias Fenn and Dr. Priya Nandi, and both of them were moving fast, pulling on gloves, scanning the incoming vitals, doing the work. "Okay," Wynn said, loud enough to cut through the noise. "We're treating these as separate traumas until we know otherwise. Fenn, take bays 1 and 2. Nandi, 3 and 4. Bay 5? He paused, and Mara saw his eyes land on her for exactly the length of time it took him to make a decision he'd already made before she arrived. "Give Bay 5 to the rookie." There was a sound that moved through the room, not quite laughter, more like the suppressed cousin of it, exhaled breath, a half-smile from one of the paramedics, a glance exchanged between 2 nurses near the supply wall, the kind of thing that doesn't need volume to land. Mara heard it. She always heard it. She didn't respond to it. She was already moving toward Bay 5. The man on that gurney was the largest of the 5. 6'2", at least, 230 pounds of muscle that had gone slack in the way that happened when a body stopped cooperating with the brain's instructions. His name was on the wristband, Decker, R. His face was turned slightly to the left, jaw set even in unconsciousness, and there was a 4-inch laceration across his right forearm that had been field dressed with the kind of efficiency that meant someone who knew what they were doing had been out there with these men. Mara snapped a fresh pair of gloves and leaned in. She didn't touch the laceration first. She checked his eyes, pupils equal, reactive, but sluggish on the left in a way the overhead lights made easy to miss if you weren't specifically looking. She pressed 2 fingers to the pulse point at his carotid and counted. Pressed her hand flat against his sternum and felt his breathing. Then she checked his gear. The paramedics had cut away most of his outer layers, but there were traces. Residue on the skin near his collar, grayish-white, almost chalky, the kind of thing that looked like salt at a distance. She looked at his hands, same residue in the creases of his knuckles. She looked at the tactical watch still strapped to his wrist, face cracked, and at the faint discoloration on the skin beneath the band. She stood up straight and looked across the room. The same residue. On all 5 of them. Not identical placement, not identical concentration. But the same substance, the same dusty gray, showing up on necks, wrists, exposed skin near collar lines. 5 different men. 5 different injury presentations. Same contamination source. She felt something settle in her chest. Not calm exactly, more like the opposite of panic. A kind of cold, operational clarity. "I need a full tox panel on Bay 5, she said to the nearest tech, a young man named Greer who looked startled by her volume. "And I need someone to photograph the residue on his skin before you clean him up." Greer stared at her. "Now," Mara said, without heat, without apology. "Please." Across the room, Dr. Fenn glanced up from Bay 2. "What residue?" "The gray substance on the patient's neck and hands. All 5 of them have it." She said it clearly enough to carry. "I think we need to treat this as a common exposure event, not 5 separate traumas." There was a pause. The kind that happened in rooms when someone junior said something the senior people hadn't said first. Dr. Wynne turned slowly. He looked at her with the particular patience of someone who had already assigned her a category and was waiting for her to confirm it. They were in a training accident, not a chemical plant. The paramedics cleared for hazmat. "I know," Mara said. "And I'm not saying hazmat. I'm saying the gray residue on 5 patients from the same incident needs to be documented and analyzed before we assume it's irrelevant." A beat of silence. "Noted," Wynne said, in a tone that meant the opposite. He turned back to his patient. Mara turned back to hers. Decker's blood pressure was reading on the low end of acceptable, 94/62, which on a man his size meant his body was compensating for something, not resting comfortably. His oxygen saturation was 96%, which looked fine on the monitor and felt wrong to Mara in a way she couldn't immediately put into a sentence. She pulled the stethoscope from around her neck and listened to his chest. Left lung field, clear. Right lung field. She held still, pressed the diaphragm more firmly, and listened again. There. Not absent, but different. A quality to the breath sound on the lower right that didn't match what the monitor was reporting. Reduced, slightly. Not enough to show up on the pulse ox yet, not enough to flag on the vitals screen. But there. She stepped back and looked at the portable chest X-ray unit near the wall. "I need an X-ray on Bay 5, she said. "Chest, right lateral." Greer, who had recovered from his earlier surprise, moved toward the unit. Dr. Nandi, working 3 bays over, glanced across with an expression Mara couldn't fully read. Not dismissive, maybe skeptical, maybe something else. "His SATs are 96, Nandi said. "I know." "That's within normal range." "I know," Mara said again. "I still want the film." She was already moving back to her patient when she heard Fenn, 2 bays over, say something under his breath to the other resident. She caught the word paranoid and the shape of a smirk in his voice and filed it away without stopping. The X-ray came back in 7 minutes. She held the film up to the light and looked at the lower right lung field, a thin crescent of white. Barely there. The earliest possible sign of fluid accumulation. Not a hemothorax yet, not even close, but the beginning of one. If she hadn't been looking for it specifically, if she had trusted the 96% saturation and moved on, she would have missed it entirely. In another 40 minutes, maybe 50, Decker's oxygen would have started dropping in a way that would have looked sudden and unpredictable to anyone who hadn't seen this first image. She'd seen this before. Not in a hospital. In a different kind of field. She turned and walked directly to the charge nurse station where Dr. Wynne was reviewing something on the patient system. She didn't wait for a pause in his focus. Bay 5 has early fluid accumulation in the right lower lung, she said. I need to start monitoring for hemothorax progression. I want a repeat film in 20 minutes, a second IV line, and I'd like to discuss whether we should get cardiothoracic on the phone. Wynne looked at her, then at the film. His expression moved through something: surprise, resistance, the particular friction of a man who didn't want to be redirected and was trying to decide if the information justified it. His SATs are, 96, yes, she said. Right now. I'm asking you to look at where they're going. He took the film from her, tilted it, looked at the thin white crescent in the lower right field. That could be artifact, he said. It could be, Mara said. Do you want to wait and find out? Another pause, longer this time. Set up the second line, he said finally. I'll review in 15. 20 minutes on the repeat film. Fine. She was back in Bay 5 before the word finished leaving his mouth. 18 minutes later, the monitor at Bay 3 erupted. Patient 3. The chart said Vasquez, E, and he was the youngest looking of the 5, maybe 25, with a face that belonged on someone who had not yet decided whether the world was trustworthy, went into a rapid deterioration that hit his readings like a switch being thrown. Heart rate spiked, pressure tanked. The monitor started its cascading alarm sequence, and Dr. Nandi was at his side in seconds, calling for a crash cart, her voice controlled but carrying the urgency that Mara recognized as someone managing fear with training. Mara watched from Bay 5. She watched the way Vasquez's body was behaving, the specific sequence of the crash. Heart rate up, then pressure down, then the particular way his color shifted. She had seen that sequence before too. Not in a hospital. She walked to the supply wall, pulled a specific piece of equipment without asking anyone, and walked to Bay 3. What are you doing? Fenn said, stepping slightly into her path without fully committing to blocking it. Helping, she said, and moved around him. She reached Nandi's side and spoke quietly. His pressure's dropping because of neurological dysregulation, not volume loss. If you push fluids aggressively right now, you'll create a secondary problem. He needs vasopressor support and neuroassessment first. Nandi looked at her. How do you know that? The sequence of the crash, Mara said. Heart rate elevated first, then the pressure drop. Volume loss would have given you pressure drop first. This started in the nervous system. A beat. I have to act on what I'm seeing, Nandi said, but she had stopped reaching for the fluid bolus. I know, Mara said. I'm asking you to also act on what I'm telling you. 5 seconds to call neuro and see what they say. Nandi looked at Vasquez, looked at Mara, made a decision in the space of a breath. She grabbed the phone. The neuro fellow on call took 4 minutes to get back with a recommendation that aligned almost exactly with what Mara had said. By the time Wynne arrived at Bay 3 to review the crash, Vasquez was stabilizing on a vasopressor drip, and Nandi was explaining the intervention with a particular tone that said she believed in it. Wynne looked at Mara. She was already back in Bay 5. At 12:34 a.m., Decker's repeat chest film came back. The crescent had grown. Not dramatically. It was still early, still manageable. But it had grown in the 19 minutes between the first image and the second, which meant the rate of accumulation was faster than a simple contusion would explain. Mara looked at the two films side by side and did the math without paper. She pulled her phone, checked the time, and wrote 3 numbers on the back of a glove wrapper. 19 minutes, 4mm increase. Projected to critical at approximately 47 minutes from now. She walked back to Wynne. He was with Fenn at Bay 2. He saw her coming and something in his expression shifted. Not softness exactly, but a recalibration. Like a man adjusting the lens on a camera he wasn't sure he'd been using correctly. Decker's fluid is accumulating faster than a blunt trauma pattern, she said, handing him both films. At this rate, he'll be in a clinical hemothorax within the hour. I want to place a chest drain, and I want cardiothoracic at bedside. Fenn looked at the films over Wynne's shoulder. He's still maintaining SATS. He's maintaining, Mara said, because he's a 230-pound man with exceptional cardiovascular reserve. He'll compensate right up until he can't, and when he can't, it'll happen fast. She paused. I've seen this before. Where? Fenn said, with the edge of a challenge under it. Mara looked at him directly. In the field. What field? He said. You're a first-year floor nurse. She didn't answer. She looked back at Wynne. Wynne looked at the films for a long moment. The room behind them was loud. Alarms cycling, voices overlapping, the constant percussion of a trauma floor dealing with 5 patients at once. In the middle of all that noise, there was a specific quiet around the two of them. "Get cardiothoracic on the phone," Wynne said. "To Mara, not to Fen." Fen's jaw tightened. Mara nodded and turned back to the supply cart to start preparing the chest drain kit. As she was pulling the equipment, she passed Bay 1 and glanced at Patient 1, Calloway M., per the wristband. He was conscious, which the others weren't. His eyes were open and tracking the ceiling, the particular blank focus of someone managing pain with discipline instead of comfort. He'd been assessed and was flagged as the most stable of the 5. Mara slowed. She looked at his hands, resting on the gurney at his sides. The residue was on his knuckles, the same gray-white as the others. She looked at the slight tension in his neck muscles. Not the tension of pain, but something more controlled, the kind of tension that came from a person choosing not to move rather than being unable to. She stopped at his bedside. "Calloway," she said. His eyes moved to her immediately. Sharp, clear, and carrying the particular assessment quality of someone who had spent a lot of time evaluating whether a person could be trusted before deciding to speak. "You're the nurse," he said. His voice was rough but steady. "I'm your nurse," she said. "Can you tell me if you have any numbness in your extremities?" A pause. "Some. Both hands. Started about 20 minutes ago." She checked the chart quickly. That wasn't in the documented assessment. "Did you tell the doctor?" "I told the paramedic," Calloway said. "She wrote it down." He glanced toward the entrance. "Don't know if it made it into the chart." It hadn't. Mara picked up his left hand and began pressing lightly along the fingers, watching his face. Tingle? Shooting pain? Tingle. Like when your arm falls asleep but it doesn't wake up. She looked at the gray residue on his knuckles again. Then at the watch on his wrist. The same tactical design as Decker's, same scuffed face, same military-grade strap. She noted the discoloration on the skin beneath it. A faint redness, almost like a chemical irritation. Something moved through her mind fast. Not a thought exactly, more like recognition. Like seeing a word in a foreign language you hadn't heard in years, and understanding it before you'd finished reading it. She set his hand down gently. "I'll be right back," she said. She walked to the supply room at the back of the bay, away from the main floor noise, and stood there for exactly 30 seconds with her hands flat on the metal counter and her eyes on the wall. 5 men. Same training accident, same residue. Neurological symptoms in at least 2 of them. Vasquez's crash, Calloway's bilateral hand numbness. Early hemothorax in Decker, with an accumulation pattern that didn't fit standard blunt trauma. The specific sequence of Vasquez's cardiac event. The particular discoloration under the watchbands. She knew what this was. She had seen it assembled differently. Not in a hospital, not under fluorescent lights, not on a gurney. She had seen it in a different kind of environment, with different tools and no time and nobody to call. She had identified it then, and she was identifying it now, and the recognition sitting in her chest was cold and certain and not at all reassuring. These men had not simply been injured, they had been exposed. The training incident that brought them here had involved something that contaminated them before extraction, and the contamination was still active in their bodies. And the clock on every single one of them was running at a rate this hospital didn't know yet. She pushed off the counter and walked back to the floor. She found Wynne standing at the central station, reviewing something on a tablet, the cardiothoracic fellow on the phone beside him. She positioned herself directly in his line of sight and waited for him to finish his sentence. "I need to speak with you," she said. "Now, privately." He looked at her. The now had landed differently than he expected. He could hear it, she knew, because his expression changed in the way that happened when the register of a voice surprised a person. He handed the tablet to Fen and walked to the hallway door. She followed him through. The corridor outside the trauma bay was bright and empty and smelled of antiseptic and the particular brand of exhaustion that lived in hospital hallways after midnight. Wynne turned to face her and crossed his arms, not aggressively, more like a man bracing himself for something he wasn't sure he wanted to hear. "Talk," he said. "These 5 patients weren't injured separately," Mara said. "They were exposed to a chemical or biological contaminant during the incident, and the exposure is driving their presentations. The gray residue on their skin is part of it, Vasquez's neurological crash, Decker's hemothorax rate, Calloway's bilateral hand numbness that nobody documented. These are systemic effects from a shared exposure, not coincidental separate traumas. Wynne stared at her. That's a significant claim, he said. I know. Based on what? You haven't had time to run a full tox panel. Based on the clinical picture, she said. The residue, the symptom pattern, the timing of each presentation relative to the others, and the fact that Vasquez's crash followed a neurological dysregulation sequence that doesn't occur from physical injury alone. She paused. And based on experience with this type of exposure. There it was, hanging in the corridor between them. Wynne's eyes narrowed. What kind of experience? The kind that isn't on my personnel file, she said. Not yet. That's not what matters right now. What matters is that if I'm right, every treatment plan in that bay is incomplete, and we need to contact whoever oversaw this training operation and find out exactly what these men were exposed to before we make another decision. A long silence. Wynne's jaw worked. And if you're wrong, he said, then you lose 20 minutes making a phone call and you've been overly cautious, Mara said. And if I'm right and we don't make that call, we lose one of them. The weight of it settled over the corridor. Wynne uncrossed his arms. Who do we call? He said. Mara was already pulling out her phone. I'll tell you in a second, she said, and began scrolling to a contact she hadn't used in 2 years. A number she had memorized the way you memorize the things you were told you might one day need in an emergency, filed it in the back of her mind under unlikely but not impossible, and hoped every year that she would never reach the moment of needing it. She had reached it. The phone rang once, twice. On the third ring, the line connected, and the voice that answered was the voice of someone who did not sleep on a schedule and was not surprised to be called in the middle of the night with a problem that required a specific kind of knowledge. Solis, the voice said. Just that. Her last name. We have 5, she said. Harlan Ridge. I need to know what they were carrying. A pause on the other end, one breath. Don't treat the contamination sites, the voice said. And don't let anyone else touch the gear. The line went dead. Mara lowered the phone and looked at Wynne. His face had gone very still. Who was that? He said. She took a breath. Someone who knows what's in that training compound, she said. And we need to get back inside because in approximately 38 minutes, one of those men is going to crash, and it's not going to be the one everybody's watching. She turned and pushed through the trauma bay doors. Behind her, she heard Wynne's footsteps following, faster than she'd heard them move all night. And across the bay, over the sound of monitors and voices, and the relentless procedural noise of 5 emergencies happening at once, she could already see which patient was beginning to change. It was Bay 2. Not Decker, who had the most visible injury. Not Vasquez, who had already crashed once and was being watched with the kind of hypervigilance that came from nearly losing a patient. Bay 2. Merritt, T. The one the paramedics had flagged as walking wounded before he lost consciousness in transit. The one Fenn had assessed in the first 12 minutes and noted as stable in monitoring. The one nobody had looked at hard since. Mara moved to him first. Merritt was 31, according to his wristband, and he had the particular kind of stillness that wasn't rest. His chest moved, his monitor beeped. His numbers sat in the low acceptable range that made a person look like a problem that had been handled. But his color was wrong in a specific way. Not pale, not gray, but a very faint yellow undertone in the skin around his mouth that the overhead lights would have washed out completely if you weren't standing at the right angle. She pressed 2 fingers to his wrist and counted against her watch. His pulse was too regular. Not a good regular. A flat mechanical regularity that meant his heart was working on autopilot, not responding to the body's signals the way it should be. She pulled back his lower eyelid and checked the conjunctiva, the pale pink mucous membrane that turned white when the body was in real trouble. Still pink, but barely. She looked at the gray residue at his collar line, more concentrated than Decker's, more than any of the others. Her hand was on the call button before she'd finished the thought. I need a 12 lead on Bay 2, she said when Greer appeared, and I need it done before he's moved for anything. Fenn cleared him an hour ago, Greer said. Not challenging exactly, more like a man flagging a potential conflict he didn't want to walk into. I know, Mara said. 12 lead. Now. Greer went. Wynne was standing 4 feet behind her. He had followed her in from the corridor without speaking and had stayed quiet in that particular way that meant a man was recalibrating something privately and didn't want company while he did it. She felt his presence but didn't turn around. "What are you seeing?" he said. "Hepatic involvement," she said. "The jaundice is just starting, which means whatever they were exposed to has been in his system long enough to begin affecting liver function, and that changes the metabolism of everything we've given him so far." A pause. "That's a big jump from skin discoloration," Wynne said. "It's not the only sign." She pointed to the monitor. "His heart rate pattern is flat, not steady, flat. His autonomic nervous system is starting to disengage from the feedback loop. That's systemic toxicity, not injury." She heard Wynne exhale, not dismissively, more like a man setting something down he'd been carrying. "You said you knew what this was," he said quietly. "In the hallway. You said the person on the phone knows what was in the compound. So tell me what you know." Mara looked at Merritt's face for one more second. Then she turned. "Not here," she said. "Give me the 12-lead result first. Then I'll tell you." The 12-lead came back in 9 minutes and confirmed it. She laid the printout flat on the station counter and pointed to the segment between two specific peaks on the trace. A subtle flattening, nothing dramatic, the kind of finding that got missed on busy nights when 5 patients were competing for attention and the obvious emergencies were pulling every eye in the room. Wynne leaned over the paper. He looked at it for a long time. "QT prolongation," he said, "early, and combined with the hepatic signs, the neurological presentation in Vasquez, Calloway's hand numbness." She stopped, arranged her thoughts into the most efficient possible shape. "This isn't a random toxic exposure. Whatever they encountered in that compound has cardiovascular, neurological, and hepatic components. It's a compound agent, and I've seen a version of it before." Wynne looked at her. The trauma bay around them moved with its own noise. Fen at Bay 1 adjusting something, Nandi checking Vasquez's pressure, 2 techs moving equipment between stations. The ordinary chaos of controlled emergency. But here, at the center station, there was a stillness that had been building since Mara walked back through the doors. "Where?" Wynne said. It wasn't quite a question. "I can't give you the full answer in this room," she said. "What I can tell you is that the treatment protocol for each of these men needs to be adjusted immediately. The standard trauma pathway is going to accelerate the systemic effects because it doesn't account for the multi-system involvement. We're treating injuries when we need to be treating exposure." Wynne's jaw moved. She watched him work through it. The pride of a man who had spent 15 years being the most qualified person in his trauma bay, running into the reality that the 11-week floor nurse standing across from him was telling him something his training hadn't covered. "What do you need?" he said. The words were flat, stripped of everything except function. It cost him something to say them. She heard it. "Toxicology on the phone. Not to run a panel, to advise. I need whoever handles chemical exposure protocols, and I need them in the next 10 minutes. She glanced toward Merritt. "I also need to adjust his drip. He's metabolizing the sedation agent at a rate his liver can't support right now, and if we don't reduce the dose, he's going to go into a prolonged arrhythmia within the next 20 minutes. "Walk me through the adjustment," Wynne said. She did. Standing at the counter, not at a computer, not with a reference pulled up from her head in specific numbers, with the reasoning behind each one stated plainly and without performance. Wynne listened, asked 2 questions. Both questions were real ones, not tests. She answered them directly. "Okay," he said when she finished. "Do it." She was already moving. Fen found her at Merritt's 4 line 7 minutes later. She heard him before she saw him. The particular footstep pattern of someone moving with intention toward a confrontation they'd already composed in their head. She finished adjusting the rate on the drip before she turned, because the adjustment mattered more than whatever he was about to say. And she had learned a long time ago that some conversations were better entered from a position of completion. "You don't have authorization to adjust that protocol," Fen said. He was standing just inside the bay, arms crossed, the fluorescent light catching the sharper edges of his face. He was probably 34, 35, with the particular brand of confidence that came from being the smartest person in every room he'd been in until recently. Mara recognized the type. She'd worked with versions of him in other places, in other configurations, and she knew that the confidence wasn't fake. He was genuinely skilled. He was also genuinely threatened, and the combination made him precise and dangerous in a specific way. Dr. Wynn authorized it, she said. Wynn hasn't reviewed your reasoning fully. He reviewed it more than enough, she said, and the patient's 12 lead supports the adjustment. Ben took a step closer. Not aggressive, but more like a man trying to establish proximity as authority. You're a floor nurse with 11 weeks of experience at this facility. You're adjusting medications in a trauma bay based on claims about a previous career that nobody has verified. Mara looked at him steadily. Is the patient's QT prolongation on the 12 lead not enough verification for you? QT prolongation has multiple causes. It does, she agreed. And in combination with the hepatic indicators and the neurological crash in Bay 3 and the hand numbness in Bay 1. That wasn't documented anywhere. The most coherent explanation is systemic toxicity from a compound agent. If you have a more coherent explanation, I'd like to hear it. Ben's mouth closed. I'm not trying to run your department, Mara said. I'm trying to keep 5 men alive. If you think my adjustment is wrong, call a pharmacist and run the numbers. I'll wait. She pulled off her gloves. But I won't wait longer than 5 minutes, because Merritt's window is moving. She dropped the gloves in the biohazard bin and moved past him. Behind her, she heard Fenn exhale through his nose, that specific sound of a person who has lost an argument and knows it and is angry about knowing it. She didn't look back. The toxicologist on call was a woman named Dr. Simone Varga, and she answered the phone with the alertness of someone who had been awake for a while before it rang, which meant someone had called her earlier, which meant the phone call Mara had made from the corridor had already started a sequence of things she couldn't fully see. Wynn held the phone between them at the central station. Mara spoke. She outlined the 5 patients, the symptom pattern, the residue, the specific sequence of each presentation, the QT prolongation in Bay 2, the neurological crash in Bay 3, the hepatic indicators she'd identified. She spoke in the compressed language of clinical communication. No excess words, no hedging, no apology for the specificity of what she was saying. Varga was quiet for the first 90 seconds. Then, what does the residue look like? Texture. Fine grain, grayish-white, concentrates at skin folds and contact points. Slightly adhesive. It doesn't brush off easily. Another pause. Is it uniform across all 5 patients, or are there concentration differences? Differences, Mara said. Merritt, Bay 2, has the highest concentration. Decker, Bay 5, secondary. Vasquez and Callaway, Bays 3 and 1, lower but present. Bay 4, Huang, R. Lowest visible concentration, but the most delayed symptom onset. That last part she had only confirmed in the last hour. She'd checked Huang Bay 4 twice since moving Wynn to a different view of the situation, checked and found a patient who looked stable by every standard measure, and who had, in the last 15 minutes, begun showing the very first signs of peripheral vasoconstriction. Cold extremities. Capillary refill slowing by half a second, subtle but directional. Varga's voice changed, not dramatically, but enough. The delayed onset in the patient with lowest surface concentration is consistent with dermal absorption rather than inhalation, she said. If that's the delivery mechanism, the compound was aerosolized and then settled. The men with highest surface contact were closest to the source point. That's what I thought, Mara said. You thought that based on what background? Varga said. A brief silence. Field experience, Mara said. On the other end, Varga made a sound that wasn't quite agreement and wasn't quite skepticism, more like a scientist logging an anomaly. The treatment adjustments you've made so far are consistent with the exposure profile, Varga said, and Mara heard Wynn shift his weight beside her. I'm going to recommend we also start a specific chelation protocol for the patients showing hepatic involvement. I'll fax the protocol to your facility in the next 15 minutes. Do not give any of these patients acetaminophen under any circumstances. It will accelerate the hepatic load. Understood, Mara said. One more thing, Varga said. The compound you're describing, if my read is right, the most acute risk window is between hours 2 and 4 post-exposure. What's your current timeline? Mara checked the clock. 1:08 a.m. She looked at the paramedic report time, 10:52 p.m., initial incident. We're at approximately 2 hours and 16 minutes, she said. Silence on the line. Then you're already in it, Varga said. All 5 of them. The line didn't go dead this time. Varga stayed on. But the information sat in the air above the counter like a weight that had just been set down on a surface that hadn't been built to hold it. Wynne turned to look at the trauma bay. All 5 bays, the monitors, the techs, and residents working. The carefully managed, organized emergency that now had a different shape than it had 2 hours ago. "Fen," he said, and his voice carried in a way it hadn't all night. "Nandi, get over here." The next 40 minutes were the kind that compressed time in both directions simultaneously, each individual moment stretched out by the demands inside it, while the whole period collapsed in retrospect to almost nothing. Mara moved between all 5 bays in a pattern that wasn't random. She had mapped the risk timeline in her head during the phone call with Varga, ordered the 5 men by where they were in the exposure progression, and now she worked that order with the methodical efficiency of someone who had managed multiple simultaneous critical patients in conditions where the methodical efficiency was the only thing standing between the patients and catastrophe. Decker first. His chest drain was already placed, the cardiothoracic fellow monitoring the output. The rate of accumulation had slowed marginally, not enough to celebrate, but enough to indicate the treatment adjustment had created some traction. Mara checked his drain, checked the repeat film that had just come back, noted that the crescent hadn't grown in the last 20 minutes. She updated the cardiothoracic fellow in 3 sentences and moved. Vasquez next. His vasopressor drip had stabilized his pressure, and the neurological assessment that Nandi had ordered showed no new deficits. He was still unconscious, but his brain activity, per the portable EEG the neurofellow had ordered, was within range. Mara checked his extremities, noted the temperature differential between his hands and feet, made a note in the chart about monitoring for peripheral vasospasm as the exposure progressed into hour 3. Calloway, Bay 1, the conscious one, the one who had told her about his hand numbness before anyone else documented it. She stopped at his bedside and he tracked her the same way he had the first time, with that immediate, careful focus. "How are the hands?" she said. "Worse," he said, without drama. "I expected that," she said. "We're adjusting your treatment. The numbness should plateau before it improves. Don't be alarmed if it gets slightly more pronounced in the next hour." He looked at her for a moment. "You know what we were exposed to." It wasn't a question. "I have a working diagnosis," she said. "Your commanding officer is going to be contacted for specifics." Something moved in Calloway's face. Not surprise. Something more like the particular recognition of a person who had dealt with institutional information management before and knew how it worked. "They're going to say they don't know," he said. "Some of them won't know," Mara said. "Some of them will." Calloway's eyes stayed on her for another beat. "You're not just a nurse," he said. "Are you?" She held his gaze. "Right now I am," she said. "That's what matters." She moved to Bay 4. Huang was the one she was most worried about. The delayed onset presentation, the low surface contamination that had lulled everyone into flagging him stable, was the one that had historically killed people. Not because it was the most severe exposure, but because it stayed invisible long enough that by the time the symptoms emerged, the treatment window had partially closed. She'd seen that before, too. She had seen the person who looked fine right up until they weren't. His capillary refill was now running at 2 full seconds. His extremities were cold. She took his blood pressure in both arms and got a 14-millimeter difference between the readings. Small, but significant, indicating the vascular tone irregularity was starting to propagate. She pulled out her pen light and checked his pupils. Equal. Reactive. But the left one lagged by a fraction of a second on the constriction. She put the pen light back in her pocket and pressed the call button. "I need Varga back on the line," she said when Greer picked up. "Bay 4 needs to move up the chelation protocol priority. He's presenting the vascular signs." While she waited for the call, she straightened Huang's blanket. It was a small thing, a meaningless gesture in the clinical sense, but she'd learned in other places that the small gestures mattered for the person doing them as much as the person receiving them. It was a way of staying present, of remembering that the numbers on the monitor were attached to a person. His eyes opened. She hadn't expected that. She was already turning to look at the monitor when she heard the small sound of his breath changing and glanced back to find him looking at the ceiling with the unfocused first-second confusion of someone returning from unconsciousness and not yet sure what they were returning to. "Hey," she said quietly. "You're at Harlan Ridge Medical. You're safe." His eyes moved to her, slow but tracking. "Team," he said. The word was rough, half-formed. "They're all here," she said. "All 5 of you." He blinked. Something in the tension of his face eased by a single degree. His eyes closed again. Mara stood still for a moment. Then she went back to work. It was Fen who came to her at 1:41 a.m. She was standing at the central station reviewing Varga's chelation protocol, which had arrived by fax 12 minutes earlier, and which she had read 3 times with the particular focused reading that meant she was cross-referencing what was printed against what she already knew from a different source entirely. She heard Fen's footsteps and felt the specific quality of approach that meant this was a different kind of conversation than the one he'd initiated at Merritt's bedside. He stopped beside her, didn't speak immediately. Mara continued reading. "The QT on Bay 2 has normalized," he said finally. "I know," she said. "I checked 20 minutes ago." A pause. "The adjustment you made to the drip rate," Fen said. "The numbers were right." He said it with the particular flatness of a man who has rehearsed the sentence several times and still can't make it sound natural. She looked up from the fax. He wasn't looking at her. He was looking at the monitors across the room, the 5 bays, the work that was still happening in all of them. "I need to ask you something," he said. "Okay. How did you know the hepatic signs from visual presentation alone, before any blood work?" She considered the question. It was a real one. Not a challenge this time, not a test. The challenge had gone out of his voice somewhere in the last 40 minutes and been replaced by something that looked like it cost him more effort than the challenge had. "Jaundice presents in the sclerae and perioral skin first," she said, "before it's measurable in labs. The window between first visual presentation and lab confirmation is anywhere from 4 to 12 hours, depending on rate of progression. If you know what you're looking for and the lights are right, you can catch it in that window." "And the QT," he said. "You called that from the monitor pattern without running the 12 lead first." "I called it as a probability," she said. "The 12 lead confirmed it." Fen was quiet for a moment, the kind of quiet that meant he was reorganizing something. "Where did you train?" he said. The question landed differently than Calloway's had. Calloway had been asking something he already half knew. Fen was asking from genuine ignorance, and genuine ignorance could go several ways. "I'll answer that later," she said. "Right now I need you to check Vasquez's chest. Not his monitor, his chest. The bilateral breath sounds. He had a clean assessment at admission, and I want to make sure nothing has shifted in the last hour." Fen looked at her for a second. Then he nodded once and walked toward Bay 3. Mara watched him go. He moved differently than he had at the start of the night, with slightly less certainty and slightly more attention, which in her experience was actually the better configuration for a doctor in a trauma bay. Certainty without attention got people killed. Attention without certainty at least kept asking questions. She turned back to the chelation protocol. At 2:04 a.m. The doors to the trauma bay opened in a way that was different from the supply deliveries and shift change movements that had punctuated the last 2 hours. Mara heard it before she looked up. The sound of a door opened with authority rather than speed, and the particular quality of footsteps that followed. 2 people, measured pace, not rushing, the kind of walk that meant the people doing it had decided before they arrived how they were going to enter. She looked up. 2 people in the doorway. Both in civilian clothes, slacks, button-downs, nothing to identify them visually except the specific physical bearing that Mara recognized the way she recognized the gray residue, the way she recognized the QT trace, the way she recognized everything tonight that she'd spent the last 2 years trying not to think about. 1 man, 1 woman. The man was older, mid-50s, gray at the temples, and carrying a sealed case at his side. Flat, brushed metal, the kind that could have been medical equipment and wasn't. The woman was younger, maybe late 30s, and she was scanning the room with eyes that moved the way trained eyes moved, not looking for the most obvious thing, looking for the thing that wasn't quite right. Those eyes found Mara in approximately 4 seconds. Wynn stepped forward from the central station. "This is a restricted area. You need to check in at—" "Dr. Wynn," the man said. His voice was calm and unhurried. "My name is Alderman. We're here regarding your 5 patients. I have authorization." He held out a folded document. Wynn took it. read it. His expression did something complicated. "What kind of authorization is this?" he said. It came out almost flat, like a statement. "Federal Medical Emergency Oversight," Alderman said, "specific to exposure incidents involving classified training operations." He looked past Wynne, directly at Mara. "Ms. Solis." The room went slightly quieter. Not silent. The monitors still beeped, the ventilators still cycled, the work continued. But there was a quality of attention that shifted when Alderman said her name. Mara felt Fenn look up from Bay 3, felt Nandi pause near the supply wall. She walked toward Alderman and the woman with the scanning eyes. "The chelation protocol is running on Bays 2 and 4, she said. "Bay 5 is still at risk for hemothorax progression. I want cardiothoracic at bedside for the next 6 hours. Bay 3 is neurologically stable, but we need another assessment at hour 4 post-exposure." Alderman nodded. He had the expression of a man who had just received information he mostly already had and was confirming the gaps. "What was the agent?" Mara said. Not a question, a requirement. Alderman exchanged a look with the woman, the kind of look that moved through a decision quickly. "Triaxle compound," he said. "Experimental, multi-vector, not sanctioned for use in domestic training operations." The word "not sanctioned" sat in the air. Mara processed it. The clinical implications first. The triaxle variant, if it was the one she was thinking of, had a specific 4th-hour escalation risk that wasn't in any standard protocol. She had read about it in documentation she technically shouldn't have had access to years ago, in a different context. She ran the timeline in her head: 2:04 a.m., incident at 10:52 p.m., and hour 4 hit at 2:52, she said aloud. "We have 48 minutes before the 4th-hour escalation window." Alderman looked at her. "Yes," he said. She was already turning toward the bay. "I need the specific formulation variant," she called over her shoulder. "And I need Varga back on the phone. And someone needs to tell me why a non-sanctioned experimental compound was used in a domestic training operation, because that answer is going to affect how I treat these men." She stopped, turned back. The woman with the scanning eyes was looking at her with an expression that Mara couldn't fully categorize. It wasn't hostility, and it wasn't warmth, and it wasn't the assessment before trust look that Calloway had given her. It was something more specific than any of those. "Who authorized the operation?" Mara said. Silence. The sealed metal case at Alderman's side seemed heavier in the room than it had when he walked in. "That," Alderman said slowly, "is what we're here to find out." From Bay 5, Decker's monitor alarm fired, a single sharp tone that cut through the room like a thrown object, and Mara was moving before the second beep, and behind her she heard Wynne call for the cardiothoracic fellow, and Alderman moved to the wall to get out of the way, and the woman with the scanning eyes did not move at all. She stood in the center of the room and watched Mara run. And something in her expression changed, slowly, privately, in the way that things changed in a person's face when a theory they had been carrying for a long time turned out to be correct. Decker's alarm was a single sustained tone, not the cycling alert of a rhythm irregularity, but the flat, held note of a pressure collapse, which was worse. Mara reached Bay 5 in 4 seconds and had her hands on him before the cardiothoracic fellow, Dr. Petra Lund, made it across the room from where she'd been standing near the supply wall. Decker's systolic had dropped to 74. The drain output had spiked in the last 8 minutes. She could see it in the collection chamber, the volume wrong, too much, too fast. The hemothorax had accelerated past the rate she'd projected, which meant either the chest drain had shifted position or the source of bleeding had changed. "Drain still seated," Lund said, arriving at her left shoulder, checking the tube position with practiced hands. Output rate jumped. "New bleeder," Mara said. "Not the original site." She pressed her stethoscope to his chest. Right side, the drain side, then left. Left lung field was clear. Right side had fluid, but the drain was handling it. "Listen to his left lower," she said to Lund without moving. Lund positioned her stethoscope. A pause. "Diminished," Lund said. "It wasn't diminished 40 minutes ago." Mara straightened and looked at the monitor. Heart rate was compensating, 118, elevated, the body throwing everything it had at keeping pressure up. "He has a second sight. Left lower hemothorax developing independent of the right." "That's not from the original trauma pattern," Lund said. "No," Mara said. "It's from the compound." The triaxle variant disrupts vascular integrity at the capillary level. The accumulation isn't from a single vessel bleed, it's from microvascular breakdown, which means placing a second drain will help the pressure, but it won't stop the source. Lund was already reaching for the phone. "I'm calling the OR." "Call it," Mara said. "But while you do, I need the specific chelation sequence for vascular presentation from Varga. The protocol she faxed is the hepatic variant. Decker needs the vascular version, and I need it before we move him upstairs." She turned. Alderman was standing 6 feet away. He had moved from the wall without her hearing him, and he was holding the sealed case at his side with both hands now, which meant he had made a decision about opening it. "The vascular variant protocol is in here," he said. "Open it," she said. He set the case flat on the equipment shelf beside Bay 5 and pressed his thumb to the biometric lock on the side. It clicked. He opened it. Inside, a series of laminated protocol sheets in military formatting, the kind that were designed to be read under pressure, in bad light, with shaking hands. Beside them, 3 sealed vials in foam cutouts, labeled in alphanumeric sequences that meant nothing to a civilian and something specific to Mara. She picked up the top protocol sheet and read the first section in the time it took Lund to finish her OR call. "I need one of the IV-grade chelation boosters from Bay 2's current supply," she said to Greer, who had materialized at her right. "And I need someone to run the timing on the 4th-hour window. We're at 18 minutes. Greer moved. Wynne appeared at the edge of the bay. He had been watching from the central station. She had felt his presence tracking the room all night, recalibrating each time the situation changed. He looked at the open case on the shelf, and at Mara reading the laminated sheet, and at Alderman standing to the side with the particular stillness of a man who had brought a piece of a puzzle to a person already assembling it. "Talk to me," Wynne said. "Decker has bilateral hemothorax development. Right side we knew about. Left side is new, and it's microvascular, not traumatic. The triaxle compound breaks down vascular wall integrity. The chelation protocol in that case targets the binding mechanism specifically." She set the sheet down and picked up the second one. "But the timing matters. If we don't start the vascular protocol before the 4th-hour marker, the breakdown accelerates past what chelation can manage." 16 minutes, Greer called from the station. "Move him to the OR prep area," Mara said to Lund. "Keep him on the drain. Start the vascular protocol as we transfer." She looked at Wynne. "I need you with him. The OR team needs to understand they are not dealing with a standard hemothorax. They need to understand the compound variable, or they will close a site that will reopen." Wynne nodded. He was already reaching for his phone. Mara turned to the case, picked up one of the sealed vials, and read the label carefully. Then she looked at Alderman. "This is the triaxle 7 variant," she said, "not standard triaxle. The 7 series has an additional adrenal component." Alderman didn't answer. "That's a yes," she said. "The adrenal component means the cardiovascular patients, Vasquez and Merritt, are at risk for a secondary adrenal surge during the 4th-hour window. Their cortisol will spike, and it's going to look like they're improving right before they crash." "How do you know the 7 series formulation?" Alderman said. The question was quiet and direct, and landed differently than Fenn's had, than Calloway's had, than Wynne's had. It carried a weight that suggested the question had a specific correct answer, and Alderman already knew what it was. "Because I was in the room where it was developed," Mara said, and picked up the protocol sheet and walked away. The next 14 minutes were the worst of the night. Not because of a single catastrophic event, but because of the particular horror of multiple critical timelines running simultaneously, and the knowledge that attention paid to one was attention taken from another. Mara had 4 men to manage while Decker was being moved to OR prep. 4 patients, 2 of whom were about to experience an adrenal surge that would mask their deterioration at the exact moment the 4th-hour window opened. She found Vasquez first. He had been stable for the last hour. Stable meaning his pressure was maintained on the vasopressor drip and his neurological assessment hadn't worsened. But Mara looked at his face and saw the subtle flush beginning at the neck, the very first sign of a cortisol spike, the skin doing what it did when the adrenal glands fired unexpectedly. She pulled up his most recent cortisol order. It had been drawn 90 minutes ago. The result was in the chart, elevated but within the range that got annotated as stress response, expected. She looked at the timestamp on the result, then at the clock. In the next 6 to 10 minutes, his cortisol was going to spike to a level that would temporarily elevate his pressure and improve his apparent hemodynamic status, and everyone watching the monitor would read it as improvement, and the vasopressor drip might get reduced in response, and then when the cortisol cleared, which it would, faster than a natural adrenal response, because the triaxyl 7 adrenal component had a short half-life designed to prevent detection in post-incident blood work. The crash that followed would be faster and deeper than the first one. She knew this because she had read about it, in the room where it was developed. She needed to prevent the drip adjustment before it happened. "Nandi," she said, moving to bay 3. Dr. Nandi was charting at the side station, and she looked up with the expression of someone who had spent the last hour recalibrating and was now watching carefully rather than dismissively. "His numbers are improving," Nandi said. "Pressure is up 4 points." "It's going to keep going up for the next 6 to 8 minutes, Mara said. "Do not reduce the vasopressor drip. Do not adjust anything until I tell you the window has passed." Nandi looked at her. "His pressure going up is a good sign." "It's a false sign," Mara said. "The compound has an adrenal component with a short half-life. The spike looks like improvement. It's not. When it clears, he'll drop faster than the first crash, and if the drip is reduced before that happens, you won't be able to respond fast enough." A beat. "How long is the window?" Nandi said. 6 to 8 minutes for the spike peak. Then it clears in approximately 4 minutes. Hold the drip for at least 15 minutes after it starts rising." Nandi looked at Vasquez, back at Mara. "Okay," she said. Mara was already moving to Merritt. Bay 2. She arrived to find one of the night shift nurses, a woman named Teller, who had come on at midnight and hadn't been in the room for the first hour of all this, reaching for Merritt's vasopressor line with the adjustment look on her face. The monitors were showing a pressure improvement. Merritt's color had changed in the direction of normal. Everything visual said he was getting better. "Don't touch that line," Mara said. Teller froze. She was probably 50, experienced, with the confident hands of a nurse who knew trauma work, and didn't appreciate being stopped by someone who had been at the facility for 11 weeks. "His pressure is up," Teller said carefully. "I know. Don't adjust the drip." "Who authorized—" "I did." Wynn was at the bay entrance. He had delegated the OR transfer to Lund and come back. He looked tired. Not the tired of a long shift, but the tired of a man who had spent 2 hours adjusting to a reality he hadn't anticipated. "Leave the line, Teller. Follow Solis's protocol for bays 2 and 3 until I say otherwise." Teller looked at Wynn, looked at Mara, set down the adjustment tool and stepped back. The monitors kept climbing. Vasquez's pressure hit 108/71. Merritt's hit 102/68. Both numbers looked like recovery. In any other context, in any other night, those numbers would have been cause for cautious optimism. Mara stood between the two bays and watched the clocks on both monitors and said nothing and let it happen. At 2:52 a.m., exactly the 4th hour mark, both monitors started to move in the wrong direction. Not alarms, not crashes, just numbers beginning a slow, certain slide that meant the adrenal component had peaked and was clearing. And underneath it, the actual hemodynamic state of both men was not what the last 8 minutes had suggested. Vasquez first. His pressure dropped through 96, through 88, through 81. "Hold," Mara said to Nandi, who was standing ready. "Through 78. Now increase the drip. 0.2 mics per kilo per minute. Push it." Nandi moved. Merritt followed the same curve 20 seconds later, and Mara called the adjustment to Teller with the same timing, same increment, watching both monitors simultaneously from the central position she'd taken between the bays. It took 4 minutes. 4 minutes of managed, controlled intervention at the exact moment both men's bodies tried to do something catastrophic, and the intervention worked the way interventions worked when they were precisely timed. Not dramatically, not with sudden reversals, just with numbers that stopped going the wrong way and began slowly to stabilize. By 2:57, Vasquez was at 89/60. Not good, but not crashing. By 2:59, Merritt was at 93/63. Same category. Mara put her hand flat on the central station counter and breathed once through her nose. Wynn was beside her. He had watched the whole thing in silence. "You knew exactly when that was going to happen," he said. "Within a margin," she said. "How much of a margin?" "About 3 minutes." He was quiet for a moment. If you hadn't been here, he said, not as a compliment, as a statement of a clinical reality he was working through. If the night had gone differently. Don't, she said. It didn't. He nodded. But she could see him calculating something behind his eyes, something that went beyond the clinical, into the territory of how this night would look in retrospect. From the outside, through the lens of all the decisions that had been made before midnight. From across the room, Fen was watching. She noticed it the way she noticed things, not by looking directly, but by the peripheral awareness of where attention was being directed. He was at the supply wall, not working, just standing there with his hands at his sides and his eyes on the space between her and Wynne, and his expression had moved through several phases in the last hour and had now settled into something she couldn't quite categorize. It wasn't hostility, it wasn't concession, it was something more unsettled than either. She would think about that later. Right now, there was Calloway. Baywan had been the quietest of the five all night, which was its own kind of concern. Calloway was conscious, communicative, and apparently stable, but the pattern of his exposure, combined with his physical size and evident capacity for tolerance, meant that his symptoms had been presenting more gradually than the others, which didn't mean they were less serious. It meant they were harder to catch. She found him awake, which was how he'd been most of the night. His eyes tracked her as she came in. "How's the team?" he said. "Decker's in the OR," she said. "The others are holding." Something moved in his face at the word OR. A tightening around the jaw, quickly managed. He had the discipline of someone who processed difficult information in private, and she respected it by not asking him to discuss it. "Your extremities," she said. "Rate the numbness, 1 to 10. 6, he said. "It was 4 an hour ago." That was faster than she'd wanted. She checked his capillary refill, 2.5 seconds. Checked his bilateral radial pulses, comparing pressure between left and right. The asymmetry was slight, but there. "I'm going to run you through the chelation protocol," she said. "It may cause nausea and a headache. Tell me if the headache becomes severe." "What's severe?" "Anything above a 7, she said. "And let me know immediately if you lose vision in either eye or if the numbness moves above your elbows." He looked at her steadily. "That's not great news." "It's manageable," she said. "But I need you to tell me when things change, not after they've changed." "Understood," he said. She was starting to set up the chelation line when Calloway spoke again. "You were with Night Harbor," he said. Quiet, matter of fact. She didn't stop working, didn't flinch. She had been waiting for it, not from Calloway specifically, but from someone. The watch on Decker's wrist had been the first thread. The phone call she'd made had been the second. Alderman's presence in the room was the third. "I was," she said. "I thought Night Harbor was decommissioned," he said. "It was," she said. 3 years ago." A pause. "And you ended up here," he said. "Harlan Ridge. Floor nurse." "Yes." He thought about that. She could feel him thinking about it in the way she could feel Wynne recalibrating, the way she could feel Fenn's unsettled attention across the room. People processing a version of a person that didn't fit the frame they'd been using. "Why?" he said. She pulled the IV line through and connected it to the chelation solution, checked the rate, set the pump. It was something to do with her hands while she decided how much of an answer to give. "Because I was done," she said finally. "And then tonight happened." Calloway looked at her for a long moment. He didn't push further. That was something about him she'd noticed from the first time he spoke. He asked until he understood, and then he stopped. "The compound they used," he said. "Triaxyl 7. We weren't told what the training agent was. They said it was a standard environmental stress test." "I know," she said. "That's not standard." "No," she said. "It's not." His jaw set. "Who authorized it?" "That's what Alderman is trying to establish," she said. "Alderman." He said the name the way people said names they recognized from a context that didn't make its way into normal conversation. "He's oversight." "Yes." Calloway looked at the ceiling. His fingers moved slightly against the blanket. Not agitation, just the small motor discharge of a person controlling a larger internal response. "Someone in the chain signed off on a non-sanctioned experimental compound for domestic training use," he said slowly. "And then when something went wrong, they sent us here." He paused. "Were we supposed to make it here?" The question sat in the air between them. Mara had been thinking the same thing since the moment Alderman said the words, "not sanctioned." She had not yet said it aloud because saying it aloud in a trauma bay was not the same as thinking it in the precise, controlled space where she'd been keeping it. "I don't know," she said, "but you're thinking about it." "I'm thinking about your chelation rate," she said, "which is what I need to be thinking about right now." He accepted that, closed his eyes. Let the protocol do its work. She stood at his bedside for a moment after she finished, not doing anything clinically necessary, just there. The way she'd straightened Huang's blanket, the small, human things. Then she went to find Alderman. "Well, I was in the corridor outside the trauma bay, standing with the woman whose name Mara still didn't have. They were speaking in the low, efficient register of people who worked together and didn't need to explain context to each other." Mara pushed through the door. "Who authorized the operation?" she said. No preamble. Alderman turned. He had the expression of a man who had been waiting for this question and had not entirely decided how to answer it. "That's under active investigation," he said. "I have a patient in Bay 1 who just asked me if they were supposed to make it to this hospital," she said. "I need to know if there's a safety issue beyond the compound exposure." The woman spoke for the first time. Her voice was level and deliberate, like words being placed with care. "We don't have evidence of intent to harm." "But you have evidence of something," Mara said. A beat. Alderman and the woman exchanged the look again, the rapid decision look that moved between people who trusted each other's judgment and were making a call together. "The operation was authorized at a level that should have required committee review," Alderman said. "It did not receive committee review. The authorization was processed through a single signatory in a way that bypassed the required oversight. We have the document trail." "Whose signature?" Mara said. "That's not—" "Whose signature?" she said again. Silence. The woman looked at her for a moment with that expression Mara still couldn't fully name. "Colonel Bryce Danning," the woman said. "Joint Training Operations. He is currently not reachable by standard channels." The name hit Mara somewhere behind the sternum, not because she didn't know it, because she did. She knew it from a different context, a different time. A file she had read in a room she wasn't supposed to be in, with a clearance that had since been classified along with everything else connected to Night Harbor. She had known Danning's name for 3 years. She had been trying not to think about what she knew for the same amount of time. "He knew about Night Harbor's decommissioning," she said. It wasn't a question. Alderman's face told her she was right before he decided whether to confirm it. "He was the signatory on the decommissioning order," the woman said. "Yes." The corridor felt different, not louder, the opposite. Like the quality of sound around her had compressed into something smaller and more specific. "And now 5 soldiers who were part of a program connected to Night Harbor's operational theater are here," Mara said slowly, "exposed to a compound that was developed inside Night Harbor's research division, authorized by the man who shut Night Harbor down." Neither of them answered. She looked at the door to the trauma bay. Through it, behind it, her 5 patients. "I need everything you have on the Triaxle 7 formulation," she said. "Every variant, every documented response, everything from the development file. Because if Danning pulled a specific variant for this, if this wasn't random, then the exposure profile might be different from the standard compound documentation, and I need to know if there's a 5th-hour event." Alderman picked up the metal case. The woman took out a phone and made a call without a word of explanation to either of them, turning slightly away, speaking in a compressed sequence of numbers that sounded like a code and probably was. Mara put her hand on the door. From inside the trauma bay, through the door, she heard Wynn's voice, controlled but elevated, calling her name. She pushed through. "Bay 4. Wang." He was the one she had projected as the slowest progression, the lowest surface contamination, the delayed presentation. He was the one she had checked twice and found on the edge of something and pulled back. He was the one she had categorized as a manageable risk during the 4th-hour window because his presentation was running behind the others. He was sitting upright in the bay, which was not possible. He had been unconscious 20 minutes ago. Not sitting upright the way a recovering patient sat upright. Sitting rigid, both hands gripping the side rails, his face a particular color that had no good clinical name except the color that preceded a specific kind of catastrophic event. His pupils were blown. Both of them. Fixed and dilated. A complete neurological black that meant the brain was doing something fast and irreversible. Wynne was at his bedside already, calling for the crash cart, and Nandi was running from Bay 3, and the room shifted into the particular organized emergency mode that Mara had been part of 100 times in the last 6 hours alone. She moved fast to the bedside and looked at Huang's face and knew what she was seeing and felt the cold knowledge settle into her chest like a stone dropping into still water. The delayed onset, the lowest surface contamination, the thing she had accounted for but had not fully weighted against a variable she hadn't known until 20 minutes ago. Danning had used a modified variant, and the modified variant's neurological component didn't follow the standard 4th-hour timeline. It was faster in the low-contamination patients. She had been managing the wrong clock. "He needs a mannitol push, now," she said to Wynne, "and I need an emergency neurosurgical consult. He's herniated." "He was stable 20 minutes ago." "I know," she said. Her voice came out flat and precise, and carried no room for the conversation she didn't have time to have. 20 milligrams IV mannitol, now, and get neurosurgery on the phone. Wynne grabbed the phone and she grabbed the crash cart, and behind her, through the door she'd come from, she heard the corridor door open, and Alderman's footsteps and the woman's voice still on the phone, and none of it mattered except the man in front of her and the thing that was happening inside his skull and the window, shrinking, specific, counted in seconds now, in which what she did next would determine whether he was alive in the morning. She pressed her fingers to his neck. Pulse, present, fast. Irregular in the specific way that meant intracranial pressure was affecting brainstem function. "Huang," she said. "Huang, can you hear me?" His eyes moved. Both irises shifted left, not tracking her, moving in the automatic way that meant the brain was responding to something internal. "Stay with me," she said. The crash cart arrived, and from the doorway the woman with the scanning eyes was watching, phone still in her hand, and her expression now was no longer unreadable. It was something that looked, beneath the control, like fear. The mannitol went in at 3:04 a.m. Mara pushed it herself, stood at the IV pole and controlled the rate manually, watching Huang's face for the response that would tell her whether the window was still open or had already closed. The drug worked by pulling fluid out of brain tissue, reducing the pressure, compressing the structures at the base of the skull, buying time. It was not a fix, it was a delay. And the delay was only useful if there was something worth delaying toward on the other side of it. Neurosurgery was on the phone in 40 seconds. She counted. Huang's fingers released the bed rail. Not deliberately, but with the specific limpness that meant the rigid phase had passed and his brain was moving into a different stage of the event. His eyes closed. His breathing shifted from the fast, shallow pattern of acute distress into something slower and more ominous that Mara recognized as the brainstem finding a new and lower baseline to operate from. "He's posturing," Nandi said from the left side of the bed. She was right. Huang's arms had drawn inward, wrists flexing, the involuntary response of a brain that had lost voluntary motor control. Decorticate posturing. Bad, but not the worst. Not decerebrate. Not yet. "Elevate the head 30 degrees, Mara said, "and get me a second IV access on the right. I want a backup line before we push anything else." Greer moved to the right arm. Wynne was still on the phone, and she could hear him cycling through hospital transfer protocols in the background, the specific cadence of a doctor being routed through a system at 3 in the morning. She took the phone from his hand without asking. "This is Solis, Trauma Bay, Harlan Ridge. I have a 34-year-old male, military, exposure to triaxle 7 compound, presenting with acute herniation, fixed dilated pupils bilaterally, decorticate posturing, GCS currently 6. He received IV mannitol 90 seconds ago. I need a surgical consult at bedside, and I need it in the next 10 minutes, or this patient is not going to be a surgical candidate." The neurosurgical fellow on the other end, young-sounding, not wasting time, said, "On my way. Head at 30. What's his pressure?" 94/62, dropping. "Start hyperventilation protocol. Target PCO2 30 to 35. Get him to CT if you can do it in 4 minutes." "Working on it," she said, and handed the phone back to Wynne with the CT request already forming as a sentence in her mouth. The next 11 minutes were the kind that didn't permit anything except the immediate thing. She was aware of the rest of the bay the way you were aware of peripheral sounds when your focus was pointed hard at a single point, not ignoring the other patients, just knowing their status without looking, the way you knew the position of your feet without checking the floor. Hong went to CT on a rolling gurney with Nandi running alongside, Greer managing the portable monitor, and the neurosurgical fellow, Dr. Asha Brennan, compact and fast, who arrived 3 minutes ahead of anyone's reasonable expectation, reading portable data on her tablet as she walked. Mara stayed. She stayed because Vasquez and Merritt still needed watching, because Calloway was midway through a chelation protocol that required monitoring, because Decker was in the OR, and someone needed to be the contact point when Lund called with an update. She stayed because leaving the bay would have been clinically wrong, and she had stopped making decisions based on anything except what was clinically correct approximately 5 hours ago. But she watched the gurney go through the doors, and for exactly the length of one breath she let herself feel the weight of the miscalculation. The clock she'd been running on the wrong timeline. The variable she hadn't known to account for until it was almost too late. And then she filed it in the part of her mind where operational errors went, to be examined in a quieter moment. She turned back to the bay. Alderman was standing near the central station with the metal case open on the counter, the laminated protocol sheet spread beside it, his phone in his hand showing a document image that hadn't been there 20 minutes ago. He had the expression of a man receiving information he'd been waiting for and not enjoying what it said. She walked to him. "The modified variant," she said. "Triaxle 7 modified. Was it in the development file you brought?" "It wasn't in the original file." He turned his phone toward her. On the screen, dense text, alphanumeric codes, the formatting of a research log written by someone who expected readers with specific training. "We found it in a secondary archive 40 minutes ago. The modification was made to the standard Triaxle 7 protocol 14 months ago. The change was not recorded in the primary compound registry." "Who made the modification?" "The log is attributed to a research consultant who worked under Night Harbor's Medical Research Division. The consultant's contract was terminated when Night Harbor was decommissioned." He paused. But the work continued. She looked at the document image, at the date, at the authorization signature at the bottom. Danning, again. "He didn't just authorize the training operation," she said. "He kept the research running after decommissioning." "Yes." "With what funding?" "Redirected from 3 other training program budgets over 22 months. Small amounts from each, but nothing that would flag individually." She straightened. The picture was assembling itself, so not cleanly, not without gaps, but with enough shape that she could see its edges. Danning had officially shut down Night Harbor, had unofficially kept its research running, had developed a modified compound using Night Harbor's intellectual framework, without Night Harbor's oversight structure, without anyone who had worked inside the program to check the methodology or the safety protocols. And then he had used it, on his own soldiers. "Why?" she said. The word came out more like a thought than a question. Alderman set his phone down. He looked at her with the expression of a man who had lived inside a complicated answer long enough to stop being surprised by it. "The compound was being evaluated for non-consensual diagnostic use," he said. "In the documentation, it's framed as a stress response assessment tool. Expose a unit during training, monitor systemic responses. Use the data to predict which soldiers are most likely to experience physiological breakdown under specific field conditions." He paused. "In practice, it means using your own personnel as a testing population without telling them what they're being exposed to." The room was quiet around them in the specific way that rooms went quiet when something was said that changed the shape of everything else. "And the 5 men in my bays were a test population," she said. "We believe so." She looked at the trauma bay. At Calloway and Bay 1, awake, running through the chelation protocol, with the discipline of someone who trusted the process even when the process was uncomfortable. At Vasquez in 3, stable but fragile. At Merritt in 2, same. "He miscalculated the dosing," she said. "The modified variant's neurological component was significantly stronger than the standard formulation. The projected tolerance margin was wider than the actual one. Because he didn't test it." "There are no documented pre-deployment trials for the modified variant," Alderman said. "None. It went from lab modification to field use in 14 months with no intermediate safety evaluation." She put her hand flat on the counter. "Where is Danny now?" she said. The answer arrived through Voss at 3:31 a.m. She came through the corridor door with her phone in hand, and something in her expression that had moved through fear and out the other side into cold purpose. "Danning is at Crestfield Air Base," she said. "He tried to access the classified archive for the triaxial research files 40 minutes ago. Base security flagged the access attempt and held him pending authorization clearance." She looked at Alderman. "He knows we're here." Alderman closed the metal case. "Then we move faster," he said. Mara looked at Voss. "You still haven't told me your name." A pause. The assessment quality in Voss's expression reached whatever conclusion it had been building toward. "Voss," she said. "Lieutenant Commander Raina Voss, Inspector General's office. How long have you been building this case?" 14 months, since the modification to the compound was first flagged by a budget anomaly. "And you knew I was here?" Not a question. The way Alderman had said her name when he walked in. The way Voss had stood in the center of the room and watched. "We knew Solis, M, had been assigned to Harlan Ridge," Voss said carefully. "We didn't know you'd be in the trauma bay tonight. But you knew my Night Harbor background. We knew your record, what we could access of it." Mara looked at her for a moment. "And you let tonight happen." The statement landed differently than anything else she'd said all night. Lower. The kind of low that came from something settling into bone. Voss held her gaze. "We didn't know the operation was occurring tonight. The authorization was processed 3 days ago through channels we were still mapping. By the time we identified the target location and deployment window, the incident had already occurred and the patients were in transit." She believed that. Mostly. She'd examined the parts she didn't fully believe later. "What do you need from me?" Mara said. "The clinical documentation you've built tonight," Voss said. "Your assessment records, treatment rationale, the timeline of each patient's presentation, and your interventions. All of it. It establishes the real-world effect of the compound on 5 specific individuals and corroborates the research logs from the archive." "You're building an evidentiary record," Mara said. "Yes." "For what charges?" "Unauthorized human experimentation, criminal negligence, abuse of command authority, and depending on what the investigation establishes about intent, potentially more." The weight of those words occupied the room differently than clinical information did. They belonged to a different register, not the register of immediate intervention, of managing what was directly in front of you, the register of accountability, of what came after. "You'll have everything I documented," Mara said. "Timestamps, rationale, clinical findings. All of it." She paused. "One condition." Voss waited. "The 5 men in these bays are told the truth about what they were exposed to. Not a partial briefing, not a classified summary with redactions. The full truth, in a context where they can ask questions and receive real answers." Voss looked at Alderman. He gave a single nod. "Agreed," Voss said. "Wab." At 4:07 a.m., Brennan called from radiology. "Subdural hematoma, right temporal," she said. "Small, under a centimeter. We caught it before significant shift. I want to take him to the OR for evacuation. With the mannitol on board and head positioning, his ICP has come down to a manageable level. There's a window." "Take it," Mara said. "He has a real chance. If this had been another 20 minutes..." "I know," Mara said. "Take the window." She set the phone down. The 2 words sat inside her for a moment. A real chance. And she let them sit. Let the weight of the near miss settle into her before filing it with everything else. Huang had come within a specific and measurable margin of an outcome that would not have been recoverable, and the margin had held. And the margin had held because of a sequence of decisions made by imperfect people working with incomplete information in a room that had started the night, not believing any of it was necessary. Wen was at her left shoulder. "Huang has a chance," she said. "I heard," he said. A particular silence between them. "I owe you an apology," he said. She looked at him. He was looking at the patient board, the names, the assignment notes, the clinical information arranged in the shorthand of a working trauma bay. His jaw was set in the way of a man saying something he meant and didn't enjoy meaning. "You don't owe me anything while we're still in it," she said. "I know. I want to say it before the moment passes, and I find a reason not to." He turned to look at her directly. "I handed you the most complicated patient in the room tonight as a dismissal. I stood in front of the other staff and I did it, and I thought I was making a competence judgment. I wasn't. I was making an assumption. He paused. That assumption almost cost 3 of these men their lives in ways I wouldn't have recognized until it was over. She held his gaze. You weren't being cruel, she said. You were being the person your experience trained you to be. You see a first-year floor nurse on your trauma bay at midnight, you make a category decision. That's a human thing, not a character flaw. The human thing nearly killed someone. Yes, she said. It did. And you corrected. And we're still here. She looked at the board. We can finish this conversation when they're all stable. The architecture of something, not quite a smile, but close enough, moved through his face. Fenn found her at 4:22 a.m. She was reviewing Merritt's labs, hepatic markers beginning to improve on the chelation protocol, not dramatically, but in the direction that mattered. She heard him approach and let him find the beginning of whatever he'd come to say. Vasquez's repeat neuroassessment came back clean, he said. No new deficits. Pressure is holding. Good. A pause. The vasopressor adjustment you made at the start of the night, he said. The choice, the dosing. I ran the numbers afterward. He stopped. Started again. I ran them twice. She waited. They were right, he said. The standard protocol would have made him worse. She nodded and kept reading the lab result. I need to ask you something, he said. His voice had shed the challenge quality it had carried in the early part of the night and was carrying something more uncomfortable in its place, genuine uncertainty. Not as a test. I want to actually understand something. Okay, she said. The pattern recognition tonight. The way you sequenced the patients, managed the timeline simultaneously, called clinical presentations before the data confirmed them. He paused. That is not floor nursing. That isn't standard ICU either. What are we actually talking about in terms of your background? She set the lab results down. Special Operations Combat Medicine, she said. 14 months of formal training, 7 years of operational practice, 3 of those years under a classified program. He absorbed that. Night Harbor, he said. You've heard the name. Fragments. Military medicine circles treat it like a ghost program, referenced but never detailed. That was intentional, she said. He looked at the floor. The process of reassembling a picture was visible in his face. Not comfortable, but honest. Why nursing? He said. After all that? She set both hands on the counter. Because I spent 7 years making decisions in conditions where a wrong call killed someone, she said. And I needed to do meaningful work in a context that gave me time to think. Nursing isn't a step down from anything. It's a different configuration of the same fundamental thing. You're responsible for keeping someone alive, and you do it with what you have. He looked at her for a long moment. I treated you like you didn't know anything, he said. You treated me like what I looked like, she said. People do that. It was wrong. Yes, she said. It was. She said it without softening it, because he didn't need softness. He needed the truth said plainly, and then left there for him to do something with. He nodded once, went back to his patients. At 4:51 a.m., Lund called from the OR. Decker is closed, she said. We found the second bleeder. Lateral intercostal vessel, microscopic perforation, consistent with capillary wall degradation from the compound. Both hemothoraces drained. He's in recovery. Mara put her hand flat on the counter. Prognosis. Good. He's going to have a rough few weeks, but he'll recover fully. She stood still for a moment after the call ended, just stood, and let the accumulated weight of the last 5 hours shift on its foundation. The way weight shifted when one major structural piece was confirmed solid. Then she pulled a fresh pair of gloves from the dispenser on the wall and went to check on Calloway. He was awake. He had been awake for most of the night, managing whatever was happening inside him with the specific discipline of someone who had learned to treat internal experience the way he treated external threat. Acknowledge it, assess it, keep functioning. She checked his chelation line, checked his extremities, capillary refill improving, warmth returning to the fingertips, the numbness beginning to pull back from the hands. She made a note in the chart without speaking. He said it first. Danning, he said. Not a question. The name of something he had suspected. She looked at him. They have him. Something moved through his face that wasn't relief and wasn't satisfaction. It was more complicated than either. The expression of a man who had been used by the institution he had committed himself to, and was processing in real time what that meant about the institution and about his own choices inside it. She had seen that expression before, in different people, different places. She had worn it herself, in a corridor she would not think about right now. "Were we the only unit?" he said. The question sat between them like a stone dropped in still water, and she felt the ripples of it reach the edges of everything she thought she understood about the night. "I don't know," she said, "but you're thinking about it." "I'm thinking about your chelation rate," she said, "which is where my thinking needs to be right now." Calloway accepted that without pushing. His eyes went to the ceiling. His fingers moved slightly against the blanket. Not agitation, the small motor release of a person governing a much larger internal response. "Ask Voss," Mara said. "When you're stable enough for that conversation, she'll answer you." She was stepping back from his bedside when the door to the corridor opened. Not Voss, not Alderman, not a man in full dress uniform. Rank insignia that carried weight, not the weight of ceremony, the weight of institutional authority that had rooms rearrange themselves when it walked through a door. He was accompanied by two individuals in civilian clothes who moved with the specific configuration of legal counsel. Not hospital legal, not law enforcement, but the federal variety that appeared in situations where the accountability lines ran very high. And behind them, slightly to the left, partially obscured by the doorframe, as if proximity to the threshold was itself a choice, a man Mara recognized. Not from any official capacity she could name in this room. She knew his posture. She knew the way he held himself in a doorway, the specific quality of stillness that came from someone who had trained for years not to be the most noticeable person in any space he occupied. She had seen that posture in briefing rooms, in field debriefs, in a corridor 3 years ago. In a moment she had not been meant to witness. His eyes found hers across the trauma bay immediately. The flat, direct recognition of someone who had been looking for a specific face and located it. The man in dress uniform introduced himself to Wynne in a voice that carried into the room. Brigadier General Marcus Talvert, Joint Operations Oversight. The name was not one she knew, but the title connected to things she did know, and the connection was not reassuring. Wynne looked at Talvert, then at Mara, then at Voss, in the rapid sequence of a man realizing that the situation he thought he understood had just added several new dimensions. Voss stepped forward. "General, we weren't notified of your arrival." "You weren't meant to be," Talvert said. His voice was even, unhurried, the voice of a man who had not made an unplanned entrance. "We received word of the incident at 0100 and made arrangements." He looked past Voss at the trauma bay. "I understand you have 5 of our people here." "In treatment," Voss said. "Yes." "I'd like a status update from the attending physician." His gaze moved to Wynne. Wynne opened his mouth, and then Mara spoke first. "I can give you the status update," she said. She said it from across the room, at a volume that carried without effort. "I've been managing the clinical response to the triaxyl 7 modified exposure for the last 5 hours. Talvert turned to look at her. His face made no immediate readable movement, the practice neutral of someone who had learned to receive unexpected information without telegraphing reaction. "And you are," he said. "Mara Solis. Harlan Ridge Nursing Staff." She paused. "Previously Night Harbor Unit, Medical Division." The room had gone very still in the particular way that rooms went still when a specific combination of words was said aloud that hadn't been said aloud in a long time. The man in the doorway, the one she recognized, had not moved. His stillness had changed quality, the way stillness changed when someone was making a decision about whether to remain still. "Ms. Solis," Talvert said, "perhaps we should speak privately." "I'd prefer to speak here," she said. She took 3 steps toward the center of the room, not toward him, just into the open space. "Every person in this bay has been part of managing this situation. Whatever you need to communicate to me, you can communicate in front of them." Talvert assessed her for a moment. "The 5 patients' status," he said finally. "Decker is post-operative in recovery. Bilateral hemothorax, both resolved. Prognosis good. Vasquez is hemodynamically stable on vasopressor support, neurological status intact. Merritt's hepatic markers are improving on chelation protocol. Callaway is responding to treatment, peripheral symptoms receding. Ong is in the OR for subdural hematoma evacuation. We caught it inside the surgical window. Prognosis is real. She said it like a briefing, clean, sequenced, complete. Talvert listened. The two legal figures behind him were making notes. The treatment protocols used, he said. Were they standard facility protocols? No, she said. They were modified for the specific compound exposure using documentation brought by Lieutenant Commander Voss and Mr. Alderman, cross-referenced with my operational knowledge of the compound's development. Operational knowledge, he said. From Night Harbor, she said. Yes. The man in the doorway shifted his weight, a small movement. She tracked it without looking at him directly. And the documentation Lieutenant Commander Voss brought, Talvert said. Where did that originate? Voss answered before Mara could. From the Inspector General's Archive General, obtained through a 14-month investigation into unauthorized post-decommissioning research activity. Talvert's gaze moved to Voss. Something passed across his face. Not surprise exactly, but a recalibration, the adjustment of a man who had walked into a room expecting a certain configuration and found a different one. That investigation, he said, falls under my office's jurisdiction. It falls under the Inspector General's jurisdiction, Voss said, with the precise politeness of someone who had prepared for this specific moment. Which is why I'm here, General, not why you are. The silence in the room had a texture now. Wynne was standing at the central station with both hands on the counter. Fenn was at the supply wall. Nandi had stopped moving near Bay 3. Even Greer, near the equipment shelf, had gone still in the particular way of someone who understood they were in a room where something important was happening and was not sure what they were supposed to do with their hands. Talvert looked at Voss for a long moment. Then he looked at Mara. Ms. Solis, he said. The Night Harbor program was classified at the highest level. Your involvement in any discussion of its research division's activities is... I didn't discuss the research division's activities, she said. I used clinical knowledge to keep 5 soldiers alive. The origin of that knowledge is what it is. The documentation used in your treatment protocols was brought into this facility by a federal investigator, she said. I used it to treat a documented compound exposure in 5 patients. If you have a concern about the chain of custody on that documentation, that's a conversation for Lieutenant Commander Voss. Talvert's jaw moved. One of the legal figures leaned toward him and said something at low volume. He listened. His expression did not change, but he nodded fractionally. We'll need full access to the clinical records generated tonight, he said. Those records belong to the patients and to this facility, Wynne said from the central station. He said it without moving, without altering his posture, in the flat, firm voice of a man who had just decided something. Any request for access goes through our legal department and the facility administrator. Standard process. Talvert turned to look at Wynne. It was the look of a man encountering unexpected resistance from a direction he hadn't assessed as significant. Dr. Wynne, he said, Chief of Trauma Surgery. And I mean what I said. This is a medical facility. The patients in those bays are under my care. The records generated in the course of their care are governed by facility protocol and patient privacy regulations, and that does not change based on who walks through that door. He paused. If you need those records for a legitimate federal investigation, the process exists. Use it. The room was very quiet. The man in the doorway, the one Mara recognized, made a decision. She saw it happen in the quality of his stillness, the small shift that preceded movement. He stepped forward into the room, past Talvert and the legal figures, and crossed toward Mara. He was 47, with gray at the temples that hadn't been there 3 years ago, and he moved the way he had always moved, without announcing himself. As if occupying space was a courtesy he offered to rooms rather than a right he exercised in them. He stopped 3 feet from her. Solis, he said. Renner, she said. Colonel David Renner, former operational director of Night Harbor Unit. The man who had run the program, overseen the research division, signed the deployment orders. The man who had been in the room when the decommissioning order came through and had stood at a window with his hands behind his back for a long time before turning around. You kept them alive, he said. Yes, she said. He looked at her. Not the assessing look she'd been receiving all night. Not the recalibrating look. Not the defensive look. Something older and more specific. The look of a man seeing confirmation of something he had believed for a long time but had not been able to use. I need you to know something, he said, low enough that it didn't carry across the room. What happened tonight? The compound, the authorization, the unit? I did not know. I want to be clear about that. She looked at him. Danning bypassed you, she said. He bypassed the entire chain of legitimate oversight, Renner said, including mine. His jaw set. The decommissioning was real. The shutdown was complete. What he built after, that was not Night Harbor. That was him, using Night Harbor's framework for something it was never designed to be. She held his gaze for a long moment. She believed him. She wasn't certain she should believe him, and she would think about that carefully later, in the quiet that would come eventually. The investigation Voss is running, she said. It's clean? As clean as these things get, he said. 14 months, she's thorough. Then stay out of her way, Mara said. Something moved in his face. Not offense, closer to respect, the kind that came from recognition. Danning's in custody, Renner said. It's over. It's not over, she said. Not until every man in those bays is stable and discharged and has been told the truth about what happened to them. She looked at Talvert, still standing near the entrance with his legal team and his rank and the specific kind of institutional authority that had walked into rooms all night and encountered walls where it expected open doors. And not until whoever else was involved in authorizing that operation is identified. Renner followed her gaze toward Talvert. He said nothing, but what he didn't say was its own kind of answer. She turned away from him. I need to get back to my patients, she said. She was already moving toward Bay 1 when Voss appeared at her side, keeping pace. He came to contain it, Voss said quietly. Talvert. He's not part of Danning's chain, but he's not part of the institutional response that allowed it to go undetected for 14 months either. I know, Mara said. He's going to push back on the evidentiary record. He can push, she said. The clinical documentation is already time-stamped and logged in the facility system. 15 different people in this bay have direct knowledge of the treatment sequence tonight. That doesn't disappear because a general wants it to. Voss was quiet for a step. You've done this before, she said, navigated institutional pushback on documented events. Once or twice, Mara said. They reached Bay 1. Calloway was watching the entrance, having seen Talvert's arrival with the eyes of a man trained to read rooms. His expression was the expression of someone who had just had a significant suspicion confirmed. How high does it go? He said. Mara looked at him. Then at the bay behind her, the monitors, the work still running in all of them. High enough, she said, but not higher than what we have documented tonight. She checked his IV line, checked his extremities, made her notes. The trauma bay around her continued its work. Monitors cycling, pumps running, the steady procedural noise of 5 emergencies that were slowly, in their different ways, becoming 5 recoveries. Outside in the corridor, she could hear the low register of Talvert's voice and Voss's response, the specific cadence of 2 people engaged in a confrontation that had been building for 14 months and was not going to resolve in a single conversation. That was fine. Some things didn't resolve quickly. The resolution came eventually, or it didn't, and the work continued either way. She moved to Bay 2. Merritt's eyes were open, the first time she'd seen him conscious since the night began. He was looking at the ceiling with the unfocused quality of someone newly returned to awareness, not yet ready to take inventory. Hey, she said. You're at Harlan Ridge. Your team is here. His eyes moved to her, slow, tracking. What happened? He said. The words were rough, barely there. She looked at him for a moment, at his face, the jaundice fading incrementally, the color returning in the small, measurable degrees that meant the chelation was doing its work. You were exposed to something during the training operation, she said. We've been treating the exposure. You're going to be all right. He held her gaze. Behind his eyes, she could see the next question forming. Who, how, why? The questions that deserved full answers and were not hers to give him tonight. There's a federal investigation running, she said. When you're well enough, someone will explain everything. You have the right to know all of it, and you will. He held her gaze for another beat. Then he nodded. A small, trusting movement that cost him something, because trust after something like this always costs something. She adjusted his monitor alarm threshold, checked his line, moved to the next bay. The night was not over. But outside the trauma bay windows, the Montana sky had begun its incremental shift. Not light yet, not even close to light, but the very first suggestion of a change in darkness that meant light was somewhere in the direction the world was turning toward. And in the corridor, Voss's voice had taken on a particular clarity that meant she had said something definitive. And Talvert's response had gone quiet, which meant he had heard it. And somewhere in the specific weight of that silence was the beginning of the accounting that 5 men on 5 gurneys had been owed since before they ever arrived at this hospital. Mara moved to Bay 3. She kept working. Vasquez was breathing on his own by 5:40 a.m. It happened without announcement. No alarm reversal, no dramatic number change. Just the gradual shift of a body finding its own rhythm again, the vasopressor drip doing less work because the body beneath it had remembered how to carry its own weight. Mara noticed it from 2 bays over, the way she noticed things, peripherally, without making it the center of her attention until it needed to be. She walked to Bay 3 and checked his pressure manually, listened to his lungs, watched his face for 30 seconds. Color returning. Jaw unclenched from the locked tension of unconscious distress. The particular relaxation of a person whose body had stopped fighting something it was no longer losing to. She adjusted the drip downward by a calculated increment and made a note in the chart and moved on. The trauma bay at 5:40 a.m. looked different from the same room at midnight. The difference wasn't in the equipment or the layout. The same monitors, the same supply walls, the same overhead fluorescence that bleached everything they touched. The difference was in the people moving through it. When at the central station, cross-referencing lab results with a focused attention that had shed the defensive quality it carried at the start of the night. Nandi charting at Bay 3 with the particular efficiency of someone who had absorbed a significant amount of new information in a short period and was still absorbing, still reorganizing. Fen at the supply wall, restocking, not looking for someone to correct. And Greer, young, easily startled Greer, who had watched the entire night unfold from various positions around the room and was now moving between tasks with a quieter competence than he'd had at midnight, as if something he'd observed had settled into him without his consciously deciding to let it in. That was how it happened sometimes, not in speeches or acknowledgments or the formal transfer of knowledge, just in the watching of someone do a thing the right way under conditions that made wrong easy, and the slow private recalibration that followed. Mara checked Calloway next. The chelation protocol had run its full course. His peripheral circulation was restored, both hands warm, capillary refill normal, the bilateral numbness gone except for a residual tingling in the last 2 fingers of his left hand that she told him might take another day to fully resolve. He looked at her when she said it with the expression of a man who had survived something significant and was taking inventory of what it had cost him. "The tingling I can live with," he said. "You'll want a follow-up neuroassessment in 72 hours, she said, and a full hepatic panel at 1 week. "Understood." He paused. "Decker's out of the OR. In recovery. Prognosis is good." He absorbed that. The same complicated non-relief she'd seen earlier, but layered now with something more solid underneath it. The beginning of a reckoning that would take much longer than 1 night to complete. "The investigation," he said. "Voss, is it real?" "As real as these things get," she said. The same words Renner had used, which she now weighed differently than she'd weighed them when he said them. "The evidence is documented. The authorization trail is documented. Danning is in custody." "And the people above Danning," Calloway said. She looked at him steadily. "That's what the investigation is for," she said. His jaw worked. He understood what that meant, that some accountability would be fast and public, and some would be slow and partial, and some might not come at all, because that was the nature of institutional accountability, which moved like everything large and heavy moved, with friction, with resistance, with the constant pull of the people who benefited from stillness. "You're not going to tell me it'll all be fine," he said. "No," she said. "I'm not." He nodded. That seemed to satisfy something in him more than reassurance would have. At 6:15 a.m., Dr. Brennan called from the OR. "Huang is closed," she said. "Subdural evacuated cleanly. No secondary bleeding. He's in recovery, and his neuro exam coming out of anesthesia is better than I expected. Motor responses intact, pupillary response normalized. A pause. I'm going to be honest with you. When I saw that CT, I did not expect to be making this call. Mara stood at the central station with the phone against her ear and looked at the board. 5 names. 5 bays. 5 men who had arrived in this room at 11:51 p.m. in a configuration that was, by any reasonable clinical assessment, incompatible with all 5 of them making it through to morning. "Thank you," she said to Brennan, "for moving fast." "You gave me something to move fast toward," Brennan said, and hung up. Wynne was standing close enough to hear the call's content from her expression. He didn't say anything. He just looked at the board for a moment, and then he looked at his hands on the counter, and then he straightened up and went back to his chart review. It was Fenn who said it. He had been at the supply wall, and he stopped what he was doing and looked across the room. "All 5, he said. Not to anyone specific, just into the room. "All 5, Mara said. A silence that was different from the other silences of the night. Not the silence of a room bracing for something. The silence of a room where the bracing was over and the something had passed, and what remained was the particular quiet of people who had been through the same difficult thing together and didn't yet have the right words for it. Nandi set down her pen. Greer stopped moving. Teller, who had been on shift since midnight and had stood corrected at Merritt's bedside hours ago, stood still near Bay 2 with her arms at her sides and an expression that was equal parts exhaustion and something that looked like relief finding its way through. Nobody applauded. Nobody made a speech. That wasn't what the moment was, and everyone in the room seemed to understand that without being told. Mara pulled a fresh pair of gloves from the dispenser. She had 3 more hours of monitoring before she could formally transition the patients to the day team with a clear conscience, and she intended to use all of them. Voss found her at 7:00 a.m. Exactly. Mara was at the central station documenting the overnight clinical timeline, a comprehensive, time-stamped record of every assessment, every intervention, every decision point, and its rationale, written in the flat, precise language of clinical documentation that would be read by people who needed facts rather than narrative. She had been writing for 40 minutes. She still had 40 minutes to go. Voss sat in the chair across the station without asking and waited for Mara to reach a stopping point in the sentence she was on. "Talvert left at 05:30, Voss said, "with his legal team." "I know," Mara said. She'd heard the door. "He's going to attempt to access the facility records through administrative channels," Voss said. "He has the authority to try. He does not have the authority to succeed without a federal warrant, and the warrant process will take long enough that the evidentiary record we've established will be submitted to the IG's office before he gets anywhere near it." "You anticipated him," Mara said. "I anticipated someone like him," Voss said. "There's always someone like him." Mara kept writing. "The investigation is moving faster than the original timeline now," Voss said. "Danning's arrest triggered a classified file review that found 2 additional authorization documents we hadn't located, both signed, both connecting the modified compound research to a funding stream that runs through Talvert's budget office." Mara's pen stopped. She looked up. "He didn't know what the money was being used for," Voss said. "That's the most generous read. The less generous read is that he didn't ask because not asking was more convenient than asking." She paused. "Either way, his office is now part of the investigation." "Publicly," Mara said. "Not yet, but the IG process is not quiet. It won't stay internal." Voss held her gaze. "It will become public. The accountability will be visible. I want you to know that." Mara looked at her for a moment. "You don't owe me reassurance," she said. "I know," Voss said. "I'm not offering it as reassurance. I'm offering it as a factual update from the person running the investigation to the person who generated the primary clinical evidence for it." She folded her hands on the counter. "What you documented tonight is the most complete real-world exposure record we have for the modified variant. The research logs tell us what Danning built. Your records tell us what it did to 5 specific human beings. That's the difference between a paper case and a prosecutable one." Mara looked back at her documentation. "Then I'd better finish it accurately," she said, and picked up her pen. Voss stayed in the chair for another minute, then stood without making it a moment, and left. At 8:30 a.m., the day shift arrived. The handoff took 45 minutes, longer than a standard handoff necessarily, because the night had generated a level of clinical complexity that required explanation rather than summary. Mara ran it herself, standing at the central station with the overnight documentation in front of her, and the day team arrayed around her, walking them through each patient in sequence, the exposure profile, the treatment rationale, the current status, and the monitoring requirements for the next 24 hours. The day team lead was a nurse named Dr. Bautista, senior staff, someone Mara had seen in passing 11 weeks of corridors but had never worked alongside. She listened to the handoff with the careful, slightly skeptical attention of a competent professional receiving an unusual situation from someone she didn't know well. At the end of it, Bautista looked at the documentation, looked at the board, looked at Mara. "You ran all 5 simultaneously," she said, "through the night." "With the team," Mara said. Bautista looked at Wynne, who was still present. He had not gone home, which was not standard and was also not surprising given the night they'd had. "She ran them," Wynne said. "We supported." Bautista looked back at Mara with an expression that had shifted its category. "Okay," she said. "Walk me through Huang's post-op monitoring requirements." Mara walked her through them, precisely, completely, without abbreviation. At 9:17 a.m., Mara walked out of the trauma bay. Not dramatically, not with a moment. She finished her documentation, confirmed the day team had everything they needed, checked on each of the 5 patients one final time. Decker in recovery, sleeping. Vasquez in Bay 3, off the vasopressor drip and maintaining on his own. Merritt conscious and asking for water. Calloway sitting upright in Bay 1, watching the door. Huang in the post-operative unit, neuro exam continuing to improve. And then she walked out. The corridor was bright with morning light coming through the windows at the far end. The particular light of a Montana morning that had no sentimentality in it, just clarity and cold and the flat honesty of a sky that didn't try to be anything except what it was. She stood in it for a moment. Her scrubs had been through a 10-hour shift. Her hands were tired in a way that wasn't physical. The specific tiredness of a mind that had been running at full operational capacity for an extended period and was beginning to recognize that the emergency was over and it was allowed to stop. She didn't stop. Not yet. She walked to the family waiting area down the corridor, which was empty at this hour, and sat in one of the chairs and took her phone out of her pocket. She looked at it for a moment. Then she looked at the window and the light and the empty corridor and thought, not about the night, not about the patients, not about Danning or Voss or Renner or Talvert or the institutional machinery that was now in motion. She thought about the 11 weeks before last night, the quiet halls, the routine post-ops, the chart station in the corner where she'd been finishing documentation when the call came in at 11:47. She thought about this person she'd been when she arrived at Harlan Ridge, not broken, not hiding, not running from something exactly, but done. The particular doneness of someone who had carried maximum weight for maximum time and had set it down, not because they were weak, but because they were finished. She'd chosen nursing because it was the closest she could get to the work that mattered while being a person who had decided to take up less space, less risk, less of the particular cost that came with being the person in the room who saw what others missed. Last night had cost her something. She wasn't yet sure what, exactly. Not the patients. She'd been glad for them, glad in the unambiguous way that cut through everything complicated. Not the work itself. The work had been, and she allowed herself this privately in the empty waiting room, the work had been exactly what she was built for, and there was a specific feeling in doing the thing you were built for under pressure. And it wasn't pride, it wasn't satisfaction exactly. It was more like the sensation of a key in the correct lock. You didn't need to love the door to feel the mechanism align. What it had cost her was the decision she'd made 11 weeks ago. Not because the decision was wrong, she still believed what she'd believed when she'd made it. She had needed to set the weight down. She had needed to stop being the person every room reorganized itself around the moment she walked in. That was real, and it was a real need, and she didn't regret honoring it. But last night had shown her something she hadn't fully accounted for in her calculation, that the weight didn't disappear when you set it down. It waited. And sometimes the waiting was for the right moment, not for the permanent absence of need. She didn't know yet what that meant for what came next. She thought about Calloway asking and after, and not getting a full answer. She thought us about Voss sitting across the station with the kind of certainty that came from 14 months of building something important. She thought about Renner in the doorway, complicated, partial, carrying his own version of a long night, saying you kept them alive the way people said things they had needed to say for longer than the immediate occasion. She thought about Wynne, in the corridor outside the trauma bay, asking what field. At midnight, when she was a problem he hadn't accounted for, and at 8:30 a.m. saying she ran them to the day team lead without qualification or condition. That shift, from problem to she ran them, had happened inside a single night. Not because Mara performed for it, not because she argued for it or claimed it or positioned herself toward it. It happened because she did the work in front of people who were paying attention, and the work was its own argument, and the argument didn't need her to make it. That was something worth knowing. She was still sitting with it when footsteps came down the corridor. Wynne. He sat in the chair adjacent to hers without being invited, which she found she didn't mind. He looked like someone who had been awake for a very long time and had made peace with it. "You should go home," he said. "In a minute," she said. He nodded. They sat in the morning light and said nothing for a moment, which was a different kind of nothing than the silences of the night. That nothing had been operational, the nothing of two people managing the same emergency without wasting breath. This nothing was just two people who had been through something difficult together, existing in the same space without the emergency requiring them to. "I need to tell you something," Wynne said. "Not an apology. I already did the apology." "Okay," she said. What happened last night, when it becomes visible outside this facility, people are going to ask questions about the treatment protocols, about who authorized what, who made what calls, why a first-year floor nurse was running a multi-patient compound exposure response." He paused. "I want you to know that my answers to those questions will be accurate, all of them." She looked at him. "I made the clinical decisions I made," she said. "I'll stand behind them." "I know," he said. "I'm saying I'll stand behind them with you." She held that for a moment. "That's not nothing," she said. "No," he said. "It's not." He stood, put his hands in his coat pockets. "Go home, Solis. Sleep. Whatever comes next, it'll wait until you've slept." He walked back toward the trauma bay. She sat for another minute. Then she stood and went to get her bag. 3 weeks later, Colonel Bryce Danning was formally charged. The charges were public. They could not be contained to the classified domain they might ordinarily have occupied, because the evidence was partly clinical, partly budgetary, and partly contained in a research modification log that had been entered into the federal evidentiary record by Lieutenant Commander Voss before Talvert's office had finished mapping the administrative channels they intended to use. The charges were read in open session: unauthorized human experimentation, criminal misuse of federal funds, gross dereliction of command duty, and one count of conduct unbecoming an officer that carried its own particular weight in the military context where Danning had spent his career. The Associated Federal Press ran the story on a Thursday morning. By Friday, it had been picked up by every major outlet that covered military affairs, and by Saturday, it had moved into the general news cycle, which was where things became fully real in the contemporary sense, not because the charging documents mattered less than the reporting, but because visibility was its own form of accountability. And what happened in the light was harder to walk back than what happened in the quiet corridors where institutions managed their own failures. Danning's name was everywhere. Alongside it, Night Harbor, the Triaxle 7 modified compound, the phrase unauthorized field deployment on active duty personnel, the phrase no documented safety trials, and in several of the more thorough accounts, Harlan Ridge Military Medical Center, 5 Navy SEALs, a night shift response that had prevented what the charging documents described as potential mass fatality from compound toxicity. Mara's name did not appear in the public reporting. That was not an accident. Voss had structured the clinical records submission to the IG's office in a way that protected the identity of the treating personnel while preserving the evidentiary integrity of their documentation. It was a professional courtesy and a tactical decision simultaneously, and Mara recognized it as both and was grateful for it in the way she was grateful for things she hadn't asked for, but which reflected a clear-eyed understanding of what she actually needed. She read the Thursday story at the kitchen table of the apartment she'd been renting since she arrived in Caldwell County. Small, adequate, with a window that faced west and caught the afternoon light in a way she'd come to rely on without quite realizing it. She read it once, carefully, and then she put her phone face down on the table and drank her coffee. The accountability was real, public, specific, proportionate. The mechanism she'd been skeptical of had worked, in this instance, in the way it was supposed to work. She held that, not with triumphalism, not with the vindication-shaped feeling that fiction suggested people felt when justice arrived, but with the quieter sensation of a person who had believed something was possible and had been shown that it was, and was absorbing the confirmation without needing to perform anything about it. Talvert's office was named in the investigation as part of the budget review. His involvement was characterized in the reporting as administrative failure to maintain oversight rather than criminal conduct, a distinction that frustrated her when she read it, and which she thought about for several minutes before filing it in the place where imperfect outcomes lived. Administrative failure carried its own consequences. Career consequences. Institutional record consequences. They were not nothing. They were not the same as what Danning faced. Both of those things were true at once, and she'd learned a long time ago that holding two true things at once, without resolving them into a single cleaner truth, was one of the fundamental requirements of living in the actual world. Renner. She didn't hear from directly. She heard through Voss, who called on the Friday after the story broke, professional and brief, that Renner had provided voluntary testimony to the IG's investigation and that his account was consistent with the documentation and consistent with what he had told Mara in the trauma bay. She heard that his testimony had been useful. She did not hear that it had fully resolved what she felt about his role in the history of Night Harbor, because it hadn't, and she didn't expect it to. People were not exonerable or condemnable in clean categories. She knew that about herself, too. The call from Voss on Friday also included one other piece of information. There were 2 other units, Voss said. We've identified 2 previous deployments of the modified compound in training operations over the preceding 14 months. Both were attributed to environmental factors at the time. Both unit medical records show symptom patterns consistent with exposure. Mara sat with that. Were they treated? She said. Standard trauma protocols at the time. No one identified the compound involvement. Both units recovered without fatalities. The dose concentrations were lower in both prior deployments. A pause. We believe Danning was escalating. Your 5 were a higher concentration deployment than the previous 2. The word escalating settled into her chest like something cold. The personnel from those units, she said. They'll be told? They're being notified through official channels this week, Voss said. Full disclosure, the agreement you requested extends to all affected personnel, not just the 5 from Harlan Ridge. She hadn't known the agreement would extend that far. Voss had made that decision without being asked. Thank you, Mara said. Thank you, Voss said, in a tone that didn't leave room for deflection, and ended the call. Calloway called her on the following Monday. She didn't know how he'd gotten her number, and she didn't ask, because the answer was probably something she'd rather not know the mechanism of. He called at 7 a.m., which told her something about him, and he said what he wanted to say without preamble, which told her more. I wanted to tell you the team is doing well, he said. Decker was discharged Friday. Vasquez and Merritt are both outpatient now. Huang has a long recovery ahead, but Brennan says the neurological prognosis is good. I know, she said. I've been following the discharge records. A beat. Of course you have, he said. She almost smiled. How are you? She said. Angry, he said. Correctly angry, I think. Working out where to put it. That's honest. I've had a lot of time to think, he said. Lying in a hospital bed with a chelation drip will do that. A pause. I've been thinking about what you said, that you were done, and then tonight happened. I remember saying it, she said. Are you still done? She looked out the west-facing window. The morning light was coming from the other direction, thin, early, touching the tops of things before it reached the floor. I don't know yet, she said. I'm working on it. Okay, he said. That's honest too. Another pause, slightly longer. For whatever it's worth, the 5 of us talked. About the night. About you specifically. He seemed to find the next words carefully, not because he lacked them, but because he wanted to get them right. We were trained to trust the person who shows up and does the work when it counts. Not the rank, not the record, not the title. The person. She didn't say anything. You were that person, he said. We wanted you to know we know that. She sat with it. Tell them I'm glad they're all still here, she said. I will, he said, and hung up. On the morning of the 22nd day, Harlan Ridge Medical Center issued a formal internal statement. It was not a press release. It was addressed to the staff of the trauma bay and surgical unit, distributed through the facility's internal communications system, signed by the facility administrator and countersigned by Wynn in his capacity as chief of trauma surgery. It described the events of the night in clinical summary, documented the treatment decisions and their outcomes, and contained in its fourth paragraph the following. The clinical response to this incident was led with exceptional competence and commitment by nursing staff member Mara Solis, whose assessment and treatment decisions were instrumental in preventing the loss of life across all 5 patients. Ms. Solis's professional record at this facility has been formally reviewed and updated to reflect the full scope of her qualifications and experience. The facility extends its recognition of her service and its commitment to ensuring that qualifications are assessed by demonstrated ability rather than apparent credential. She read it twice on her lunch break. The second time, she caught the phrase apparent credential and thought about what it meant. Not just for her, but for every person who had ever walked into a room carrying more than what the room could see. The nurse who had survived things the attending physician hadn't. The technician who understood the machine better than the person certified to operate it. The person standing at the edge of the group who had the clearest view of what the group couldn't see. Institutions created the frameworks for credential because frameworks were necessary. Someone had to establish minimum standards, gatekeep minimum competence. She understood that. She did not resent the framework. She resented the moments when the framework became the thing itself, when the certification stood in for the capacity, when the title replaced the ability, when the years of experience looked like nothing because they hadn't been accumulated in the expected sequence. She had been that person. She had been assessed by her apparent credential and assigned the complicated patient as a dismissal, and the dismissal had been wrong, and she had been right, and the being right had not been the point. The being right had been a means to a specific end, 5 men going home instead of not going home, and the recognition that followed was real but secondary. That ordering mattered to her. It was not about the recognition, it never had been. But the recognition, when it came, said something true about what had happened, and true things deserved to be said. She folded her phone and finished her lunch. 2 days later, she requested a meeting with Wynn. She sat across from him in his office, a small room with too many files on every surface, and a window that looked out onto the parking structure rather than anything worth looking at, which she found she respected about him. He wasn't the kind of man who needed a view. I want to talk about a different role, she said. He looked at her steadily. He had the expression of a man who had been expecting something and was not quite sure this was the shape it would take. Tell me what you mean, he said. I don't want to leave Harlan Ridge, she said. I want to stay here, but I want to work at the level I'm actually qualified to work at, which means being part of the multi-system trauma response protocol, being consulted on complex exposure cases, and contributing to how this facility approaches patients whose presentations don't follow the standard pattern. She paused. I'm also willing to develop training for the nursing staff on clinical pattern recognition, she said. The kind that comes from field experience. The kind that catches the things the monitors don't. Wynn looked at her for a long moment. That last part, he said. That's the part that matters most. I know, she said. He folded his hands on the desk. I'll talk to the administrator. The role change is straightforward given the circumstances. The training program will need to be proposed formally. He paused. I'd like to co-develop it with you. She looked at him. That's not a concession, he said. I want what you know in this facility in a form that stays after any single shift, that takes structure. I know how to build structure. You know what should be inside it. Then yes, she said. He nodded. I'll make the calls today. She stood. One more thing, he said before she reached the door. She stopped. The assignment board, he said. That first night. I put your name next to the highest risk patient as a dismissal. I've been thinking about how to undo that in a way that means something beyond the paperwork. The training program undoes it, she said. That's the version that lasts. He was quiet for a moment. Yes, he said. It is. She left his office and walked back down the corridor toward the trauma bay, toward the work that was running as it always ran. Continuous, demanding, indifferent to the personal histories of the people doing it, requiring only that the people doing it show up with everything they had and use it without reservation. She had been someone who set the weight down because she needed to. She was someone who had picked it back up because the moment required it. And she had learned in the space between those two things something that no training had explicitly taught her, that strength was not the absence of the need to rest. Strength was knowing the difference between the rest you owed yourself and the moment that required you to stand up again, and being honest. Not brave, not selfless, just honest, about which one you were standing in. Last night had been a specific night. The 5 men in those bays had been specific men. The decisions made in those hours had been specific decisions, made under specific pressure, with incomplete information and imperfect tools, and a room full of people who had to be moved from one understanding of her to another in real time. That was not every night. Most nights were quieter. Most nights were the routine that looked like nothing from the outside and was everything to the person receiving it. Most nights she would check a blood pressure and adjust a line and sit with someone who was scared and make sure they were less scared by the time she left the room. That mattered too. That mattered exactly as much. And she intended to do both, the ordinary care and the extraordinary response, with the same quality of attention, the same refusal to triage her own capacity based on what the room expected from someone who looked like her. She pushed through the trauma bay doors. The day was running. The monitors cycled. Somewhere at the end of the hall, in the post-operative unit, Huang was working through his recovery 1 hour at a time, the subdural evacuation behind him and the long, steady work of neurological healing ahead. In another wing, Vasquez's charts were being followed by the outpatient team. Decker had sent a message through Callaway that said only, "Good work." 2 words, military brief, carrying more than they said. She had 5 patients to check this morning, none of them the 5 from 3 weeks ago, all of them people who had arrived at this room carrying something that needed to be seen before it could be addressed. She pulled on a pair of gloves. She started with the patient in Bay 1, because that was where the work was, and the work was the thing that had always mattered. Not the record of it, not the recognition of it, not the way it looked from the outside to people who assigned you categories before you'd had a chance to show them anything. Just the work. And the person at the center of it, and the willingness to stay in the room until both of those things had been served as completely as you could serve them. That was what she had. That was what she'd always had. It had been enough last night. It would be enough tomorrow. And no one, no assignment board, no smirk across a trauma bay, no institution that mistook a uniform for a ceiling, was ever going to tell her otherwise.